Pharmacokinetics from Manipal University. He had his postdoctoral experience from University of North Texas Health Science Center, Fort Worth, Texas. He started his teaching career in the year 2001 and has more than 20 years of teaching experience as well as in the industry experience also. His areas of interest are clinical pharmacokinetics and population pharmacokinetic modeling and pharmacotherapy. He also currently holds the vice president in the Society of Pharmacometrics and Health Analytics and a board member of Asian Pharmacometrics Network. He has around 60 publications in national as well as international journals. He is guiding number of PhD students in his university. He is also reviewer for national and international journals, and he received number of awards and scholarships from international organization for his training as well as research. So I would like to welcome you, sir, and I will hand over this session to you, and we are eager to listen your informative session for this FDP. Welcome, sir.
Yeah. Good morning, and thank you, the organizer, for giving me this opportunity. And yeah, I'm not sitting near the beach, just it's a background. Okay, so as I understand, like most of the participants here are the diploma teachers who are taking up the new challenge of adapting to the new curriculum. And I went through the curriculum actually sometime back. We are discussing, and I had a chance now because of this to deeply go through the curriculum. Now I would say the expectation is really very high on the diploma level students. That's what is looking at the curriculum. So let me try to unpack this curriculum and try to see and explain and what are the contents, how we teach, and maybe I would like to show one particular case for hypertension. There is one example how I simplify. I just remove the complexities, make it how to teach in a simplified way. Maybe some of you can even simplify it further. And there is some practical component is there that is called super analysis. So that also I will try to explain in a simplest possible way. With that, I'm hopeful it will give some kind of light in the beginning for you. And definitely as you go along, we'll be able to, you all will be able to do it great with this curriculum also. Okay. Thank you, madam. Let us start the session.
Yes.
Yeah, I'll share the screen.
Yes.
It's visible, clear?
Yes, sir. It is.
Okay. So the theme is like pharmacotherapeutics. They mentioned, but it's all integral part of this both theory and practical. So I would like to touch upon both as per the Education Regulation 2020 for the diploma course in pharmacy. So the pharmacotherapeutics theory, this particular course is discussing about the etiopathogenesis. I will unpack every word also, don't worry. Etiopathogenesis of selected common diseases and evidence-based medicine therapy. That means common diseases, what is the, we'll talk about the etiopathogenesis in detail and how that is treated with appropriate therapy. And when we understand the therapy, we also have to understand every patient doesn't get, like for example, every hypertension patient will not get the same therapy. There is, everybody gets their own therapy based on the diagnosis and other physiological condition and how it is done. That has to be understood. And finally, when the patient is undergoing treatment and the patient is getting better, be it hypertension, blood pressure, or cholesterol, cancer, whatever it is. Cancer is not there here, we are other infectious disease. How we will measure the patient is getting better. So that we have to judge by the clinical outcomes of a drug therapy. Okay, so we will understand the pharmacotherapeutics in this way. We will understand the pathogenesis and understand about the treatment and underlying the therapeutic plans, indigenous plans, and finally how we will assess this outcome. So all of this have to be understood. That's a course objective. And then upon successful completion of this course, students will be able to, so the objectives, course outcomes are, I think, really high. The bar set is really high for the student. So we should help them to attain that kind of heights. First of all, help assessing the subjective and objective parameters of the patient in common disease conditions. Okay. Then assess other healthcare providers to analyze drug-related problem. Okay, it's part of, like, I would say, therapeutic, what's a practical component also I've added here, kept here. Participate in plan in rational therapy and design and deliver discharge counsel for patient. These are all course outcome. And theoretically, you also have to understand about the whole disease process, pathogenesis, and every component you have to understand. If you look at the theory component, the chapter 1, so there is an introductory chapter is there, which is there for 8 hours. Okay, for these, all the chapter, I've kept in some other slide, what kind of references we can check. The books also I've kept, not in each slide I've kept. Basically, what are all the books generally it's preferable to refer, at least in my understanding, I kept in some other later slides. Don't worry about that. So this particular chapter talks about the introduction to pharmacotherapeutics. What is the scope of this understanding pharmacotherapy and what's the objective? And also talks about rational use of medicines, evidence-based medicine, essential medicine list, standard treatment guideline. I'll just say, what is the rational use of medicine is like, whenever a therapy is set up, for example, a prescription is set up, there is always a reason why particular medicine is given for a particular patient. Okay, and that medicines do not have interaction among themselves, and that for a specific patient, probably it is acceptable and it may not cause undue adverse reaction, which at this anticipated adverse reactions are less in this patient. Sometimes like unpredictable reactions will come, but generally those related or interaction related adverse reactions are minimal. So that's how rational use of medicines can be ensured. Then evidence-based medicine means like whatever the prescription which you are giving is based on some kind of guideline or previous reports and trials, clinical trial and evidences. So based on that only, all of these kind of medicines will be, prescriptions will be set up. So we have to understand that in that context, what is this evidence needed for every patient? When we say like you have to use atorvastatin for treating the hypercholesterolemia, the cholesterol level is high. We can't just see some other doctors doing, I'm doing. True, we are following that, but we also will look into the evidence whether the clinical studies or trials have reported that the atorvastatin is helping the patient. So that level of evidence also we will look whenever we look into the therapy. This is one set of guideline and information to be learned. Other one is essential medicine list. So in our, especially in the countries, resource constrained settings like as India, or many countries for that matter, there will be essential medicine list prepared by the National Formulary Commission, or for example, each state, there will be a drug distribution corporations will be there by the state government, run by the state government or something like that. So they will prepare a list of most important medicines which should be available in the hospital. For primary center, what should be available? For secondary healthcare center, what should be available? For a tertiary center, what should be available? Like that, this list should be available. So we have to understand the process of setting up the essential medicine list. WHO has the essential medicine list and how that will be used at the various settings and what is the use of this settings, how this medicine list is made. So all these people have to understand, because based on this, if at all you are working in a government setting, the medicines will be available from this list. For example, you're all from Maharashtra. Maharashtra's government and the State Department may have an essential medicine list. Only that medicine will be available in the government hospitals. Okay, even if as a pharmacist, when we are setting up the therapy, or the clinicians when they write the prescription, they have to follow that. Other than that, medicines will not be available in the hospital. That's the importance of essential medicine list. Then the other topic is standard treatment guidelines. So for every drug, every disease condition, there is an organization, there is a group, sometimes WHO, sometimes there are professional organization or group. They will be setting up the guideline. These guidelines are again based on the evidence available, literature, clinical trial, FDA approvals. Based on all this information, standard treatment guidelines will be available. And whatever the treatment which we are giving will more or less, there will be variations, but more or less will follow this standard treatment guidelines. So we have to understand standard treatment guidelines to treat any disease. Based on, for example, we have I think there is a guideline for malaria, there is a guideline to tuberculosis in the country, India, there is a guideline for HIV. So like that guideline set up by the Indian government, Indian health authorities. So that is that. Then global organizations are there, WHO are there. We follow this standard treatment guideline. So as a pharmacist, whenever we are trying to do something with the therapy, help the doctor and patients, we also ensure that some amount of this guideline will be followed. That's how the pharmacotherapeutics have to be understood. So that is why this chapter is kept at the beginning of anything else. So you have to understand rational therapy, evidence-based therapy, essential medicine list, standard treatment guidelines. Okay, I mentioned the books. I will talk about the books, this from where this chapter can be referred. And sometimes we may have to use the study material also. I think it can be developed over time. So chapter 2 will talk about the disease, but before that, there is a standard set of instructions for each chapter. This will be there in every chapter. So definition of a disease, etiopathogenesis of a disease, clinical manifestations, non-pharmacological and pharmacological management of the disease. So what is this item? Definition, you know, that's a definition about that particular disease. There is a standard definition for many of the diseases. And etiopathogenesis. Etiopathogenesis means we have underlying causes. There may be risk factors. Okay, that particular underlying causes will lead to the development and progression of that particular disease, be it hypertension, diabetes, or asthma. There will be some underlying reasons, the root causes for that disease. And once a disease comes, then it progresses. There is a particular pathway for all the diseases. Again, every disease has their own pathogenesis or pathophysiology, we will call. Okay, that how the disease progresses, what are the ways, the mechanism in which the disease progresses. So put together the causes and as well as how the disease process is happening, progression happening, that is called etiopathogenesis. Okay. The next one is clinical manifestations. Clinical manifestations means how the disease present in patients. Different patients will have different presenting complaints. For example, diabetes. Diabetes means patient may complain with a condition called polyphagia, polyuria, polydipsia. What is that? Polyphagia means they will feel like hunger most of the time. Then frequent urination will be there, and polyphagia, and then thirst will be there. They will feeling thirsty. They'll keep drinking water, and then they will keep going to washroom. So basically, more urine output will be there. Why this is happening? This is because of the high level of sugar in the body, hyperglycemia, or we call it as a diabetes mellitus. Initial stages that the patients will experience. All the patients will not experience all the symptoms like that. These symptoms will come, and the patient will feel tired. Sometimes if they are not taken food, they will feel, giddiness, and they may feel unconscious also because of hypoglycemia if they don't take food. So these are all the things. For iron deficiency anemia patient will come with tiredness, weakness, breathing difficulty, and all will come. So like this, clinically, patient will present with all the signs and symptoms are called clinical manifestations. Okay, that is second part. We understand the root cause of a disease process, how this will present in the patients. Then for most of the diseases, at least most of the diseases, there will be always some kind of non-pharmacological management, lifestyle disease we call it, especially diabetes, hypertension, all those disease conditions. Sometimes if you modify the lifestyles, there may be some non-pharmacological approaches, maybe diet change, lifestyle, exercise, all of this will also part of the disease management. Okay, that also has to be understood and explained. And finally, we have to understand the pharmacological management of the disease. Pharmacological, when I say, it's all about drugs, prescription drugs. Okay, non-pharmacological, sometimes food supplements, nutrition supplements will also be given, but they are not considered as a drug therapy per se. Some kind of nutrition supplements, some herbs, plants, whatever it is, something we will recommend for some patients. That will be non-pharmacological. Then pharmacological is actual prescription drugs. So these are all the things we have to understand about every disease. Whatever the disease we study, we have to teach, and students have to understand this. That is how the whole disease is completed in terms of understanding pharmacotherapy. Pharmacotherapy is not only about the treatment, understand the disease process, progression, and how it is presenting, how it is managed, the whole thing. Okay, the first chapter section, it's not the initial introduction, we call it as chapter 1, and the whole of disease, they call it as chapter 2. In the chapter 2, we have 13 sections. Okay, section 1 is about cardiovascular system. So cardiovascular system means hypertension, angina and myocardial infarction, hyperlipidemia, congestive heart failure. These are all the cardiovascular diseases. And each disease is associated finally with your cardiac problem. Whatever happens, finally it affects your heart. That's why it's a part of cardiovascular system. At the beginning, it will start with hypertension, and slowly it will progress to more complex and finally lead to heart failure also. That's why in this order, it has been kept. So when I say hypertension, you have to understand what is hypertension, etiopathogenesis of hypertension, how the hypertension will have clinical manifestation. Hypertension is very strange because hypertension can be sometimes called silent killer. It means it will not clinically present. Those who are with hypertension will be quite normal like anybody, any other person. Nothing will happen. But finally, one day it will end up in a condition called a stroke or other cardiovascular problem. Okay. And then for treating this hypertension, there are non-pharmacological approaches. There are ways to control the salt, change the diet, exercise, everything will come. That is in the non-pharmacological approach. And also pharmacological management. There are different type of drugs for different type of patients. That we will understand finally. For all of this is hypertension, angina, or myocardial. Myocardial infarction is commonly also known as heart attack, so-called heart attack. Angina is your just chest pain will be there. And hyperlipidemia, the excessive lipids. So that will also adds the complexity to the disease conditions. And heart failure. So all of this 4 or 5 set of diseases put in the cardiovascular system. You have to understand, as I mentioned, all this component. For every disease hereafter, the same thing, etiopathogenesis, clinical manifestations, everything. So I think each topic is basically considered for 8 hours. Each topic 2 hours, totally 8 hours for this section. Section 2, I think they are giving like 2 hours for each particular disease. That's the overall trend it looks like. So asthma and COPD, these are all the common respiratory conditions. The same thing. You have to understand what is asthma or COPD, etiopathogenesis, how it is presenting clinically. Asthma will have a lot of clinical symptoms. Is because patient will feel the difficulty in breathness. Sometimes whenever they get exacerbations, allergy, they will get the acute respiratory difficulty, and we may have to give the immediate reliever medicines, and there are complex medicines are there to manage that. Inhalers are available. And what is a non-pharmacological way to handle this, and pharmacological management? Because COPD, if you look, it's mostly due to smoke, exposure to smoke, either by smoking or by maybe cooking smoke also, or occupational smoke also, other dust also. So that can all have to be discussed in the condition of COPD. So that is section 2. So like this, if I go section 3 and 4, endocrine system. So understand diabetes is an endocrine because it's connected with your pancreatic hormones. So diabetes, thyroid disorder, both hypo and hyperthyroidism. That they given like something like diabetes may be 2 hours, thyroid disorder may be 3 hours, something like 5 hours for the endocrine system. And similarly, central nervous system, your epilepsy, Parkinson, Alzheimer's, stroke, migraine, these are all like disease affecting central nervous system, okay, or brain to put it simply. So that constitutes 8 hours. And sections 5 and 6, they are gastrointestinal disorders, one of the common disorder. It could be GERD or gastroesophageal reflux disease, peptic ulcer, alcoholic liver disease, inflammatory bowel disease. So these are all the diseases affecting the gastrointestinal system, which constitutes for 8 hours, and hematological problem. Okay, there are iron deficiency anemia, megaloblastosis. There are 2 types of anemia is there. Both of them are part of this hematological, and it is very commonly we'll see this iron deficiency anemia. Definitely pharmacists can help. There are, because some kind of iron supplements and things like that, there are some procedures there that pharmacists can really help the patients in this condition. But understanding the types of anemia, and that will also help the pharmacist in better. And the major chapter or section is section 7, which is more number of diseases, and we are going through one of the recent pandemic by the infectious, that's COVID-19. So it's important to understand all kind of infectious disease, and India is one of the country with lot of infectious disease load, and many a time pharmacists will encounter this, but we don't have to diagnose, but whenever the this kind of prescriptions comes, we can actually advise the patient appropriately. The diseases are common ones are tuberculosis. There is a national tuberculosis program and all there. We can definitely know about this, guide the patients about this. Pneumonia, urinary tract infection, hepatitis, gonorrhea, syphilis, malaria, HIV, and viral infection like SARS or COVID kind of viruses. So all of this, we should have a fair idea. That's the reason these chapters are there, and definitely important for the pharmacist from the pharmacist point of view. Then we have rheumatoid arthritis and osteoarthritis, your joint-related problems. And rheumatoid arthritis is immunologically based disease condition caused by immunologically mediated. Osteoarthritis is just a physical wear and tear. And again, my management, pharmacists can support. That's the reason these chapters are there, and it's important for our diploma students to learn these diseases as well. Then other diseases, the dermatology, major diseases are psoriasis, scabies, and eczema. The psoriasis and eczema, definitely. Psoriasis especially is immunologically mediated. It's an autoimmune disease, we call it. Our own immune system is attacking our own cells and tissues, leading to the psoriasis condition, and there is an anti-inflammatory and immunosuppressant medicines will be used here. And the dermatology is also commonly seen condition in this discipline. Then the important section is psychiatric illness. We should have to understand about this medicine, because these psychotropic drugs are prone for abuse by the people. So, and we should understand what is the disease, what are the drugs, what are the characteristics. That's why these diseases are there, and roughly 4 and 2 hours are given. 2 hours for ophthalmology. The common one we see is conjunctivitis, bacterial, viral, that inflammation and infection in the eye, and as well as glaucoma. This is a condition important in this section. So other standalone section is antimicrobial resistance, because this is a major problem. And whenever the pharmacist dispenses antimicrobial antibiotics without appropriate prescription, and a lot of people are using this without any prescription, high load of antibiotics being used is one of the reasons for antimicrobial resistance. And everybody has a role, not only pharmacists, doctor, pharmacist, nurse, and patients. Everybody has a role in this antimicrobial resistance. We have to understand this. That's why I think this chapter is good. And women-specific some issues are there, understanding them, and definitely whatever we can help can be helped. That's the reason this particular chapter is there. Polycystic ovary syndrome, dysmenorrhea, premenstrual syndrome. Okay. These are all the overall sections which are in this pharmacotherapy chapter. Pharmacotherapy talks as if it looks like the therapy of the disease, sure, but we will start from etiopathogenesis. Etiopathogenesis, then understand the pathophysiology, then go through the clinical manifestation and understand the diagnosis, then set up a therapy and follow the therapy and do some advice. That is how the whole understand the pharmacological approach. This is how the whole treatment, everything has to be structured. That's how we are trying to understand the wholesome picture of pharmacotherapy. So let me give, in that sense, I took one, because hypertension we teach at like the bachelor's level, master's level, and PharmD level also. We take it at a very complex level for PharmD. So to get simple, I tried my level best to simplify. Still, it can be simplified depending on our audience. But I'm just giving one example how I will handle hypertension, at least for the diploma level. Okay. So introduction or definition about that. Hypertension is a common cardiovascular problem because, you know, if you look at the percentage of people with hypertension, there will be a lot of people will be with, you may not have a lot of people with full cardiovascular failure, but hypertension is very common nowadays. 40, 50 years of age, a lot of people have hypertension and they are on medicines, right? So it's common. So it is a condition where blood pressure is elevated to the extent where the clinical benefit is obtained from the blood pressure lowering. That means there is always a different cutoff, is 120, 130, 140 of systolic, like that people are discussing. But whatever it is, if there is a need to bring down the blood pressure, and by that way, if it is helping, then that high blood pressure is considered as hypertension. So kind of introduction to the hypertension. Very specific definition is a sustained diastolic blood pressure greater than 90 mmHg, and also accompanied by elevated systolic blood pressure more than 140 mmHg. Okay, 140 systolic, diastolic 90 mmHg. A level beyond this, you can consider as a hypertension, blood pressure beyond this level. Okay, and we can also simply say hypertension is a persistent, that's a continuous elevation. What happens, right? Why they are using the word persistent elevation? When we walk or run, right? For all of us, blood pressure will increase for all of us, but that's only transient. That's only transient for half an hour. Then when you sit down, the pressure will come down. It is a very natural process for all of us. But when hypertension is like continuously, the pressure is so high above this criteria, then only you will classify it. Because if you suddenly walk like 5 stories up and then running, then the pressure will be high. Only for short time. That's a persistent elevation of blood pressure is defined as a hypertension. So very normal blood pressure means like you have to consider anything. They say now currently less than 120 by 80. I think a lot of people will not have this now. Slightly elevated is there. But the treatment, if you want to start and all, it should be after the 140 by 90. Between this 120 and 80 and 140 by 90, that window anybody is there, we will try to use the non-pharmacological approaches for this condition. Okay. Why, if you look at the etiopathy, why the high blood pressure or hypertension is coming? Because of the increased peripheral vascular smooth muscle tone. That means blood vessels in the periphery, our body is getting very stiff. You can call it as stiff. Because they are getting stiff, they act like a pipe. So the pressure is increasing. Otherwise, normally they are very flexible at a young age. Okay, baby aging process and other risk factors make the blood vessel stiff. That's called muscle tone is very stiff. Okay, because of that, more resistant to the blood pressure, leading to blood pressure, high blood pressure. And another problem with if you have high blood pressure, the risk of morbidity, that is a further disease and other cardiovascular risks are getting higher. Okay, every time the 20 units of systolic, 10 units of diastole is increasing, very high chance of getting cardiovascular disease. That's why hypertension has to be managed. So that's the background about how that causes. And very specifically, we classify into primary and secondary hypertension, primary hypertension or essential hypertension. They say number of mechanisms are there for this primary hypertension. Hypertension is also often runs in families. There may be genetic factor involved. Plus, the same family, for example, very simple one I'll tell. The people consumption of salt, higher consumption of salt is related to hypertension. It will lead to hypertension. But salt habits, it's coming from the family. For example, how we all will take food in our home is different from different homes. Some home, they generally have, imagine, consume a lot of salt in their cooking. Imagine, everybody may have hypertension in the same family because they all have grew up taking the same level of salt, maybe high level of salt, leading to hypertension in that family. That's how, it could be that a type of risk factors we develop together. Brothers, usually when you have hypertension, you go and check your brother or sister, they will also have hypertension because the food habits, we all grew up in the same family, same type of risk factor we get. Okay, so that's why genetic factor also, the lifestyle factor also possible. So, and different type of, there could be only one reason for hypertension, monogenic, or multiple reasons could be for hypertension. Maybe kidney is affected and high salt diet and something problem, environmental exposure, stress, like that. Multiple reasons can be there, or just only one reason can be there for blood pressure. It could be possible. So that's what talks about the primary hypertension. The other one is secondary hypertension. Secondary hypertension means the hypertension due to very specific reason. The primary one, when I say this could be the risk factor, family could be the risk factor, I'm telling, I'm not saying this is the risk factor. There is no specific one specific reason. It could be anywhere, any reason, but you can't really find it which one. Here we know the specific. For example, renal disease. If the people are having kidney problem, that is leading to the blood pressure. Endocrine disease, some changes in the endocrine hormone, growth hormone. See that hypoaldosteronism, that they have, some people grow because of the excessive hormone like this, and that's called hyperaldosteronism. And acromegaly, the excessive growth hormone. These are all the preeclampsia. That means it's happened during the pregnancy. So during that time only, the hypertension will increase. That's called preeclampsia. Like this, we have a specific reason for blood pressure increase. That is called secondary hypertension. So you have two types. These are all the root causes, I would say. Okay. And then renal problem, sometimes certain drugs like estrogen, NSAIDs, cyclosporins can also increase the blood pressure. Certain food items, sodium, lot of salt, alcohol, some certain licorice, some thiamine-rich content, they say the salami, cheese, beer, wine, nuts, all of this can increase the blood pressure. Okay. Some chemicals and heavy metals can also increase the blood pressure. So like that, specific reasons can also increase the blood pressure. You call that as secondary hypertension. So risk factors, okay, what are the risk factors broadly affected? On this is smoking, hyperlipidemia, age, women who cross the menopause age, and high dietary intake of sodium and alcohol can also lead to high blood pressure, hypertension. Okay, and actually the Joint National Committee on Detection, Evaluation, and the Management of Hypertension, there is a committee or a group which set up the guideline for detection, diagnosis, and management, JNCs. And there is a lot of versions. Actually, recent version came is JNC 8. JNC 7 is also being still practiced. JNC 7 is 7th version. Now 8th version is available. That's auto update. Maybe the slides are older. Okay. So JNC 8th version is also available now. We may be updating it soon. So that's one thing. So whenever we put up a slide, we cannot keep it for multiple years because JNC 8 is now coming into the practice, and in a few years, JNC 8 will be fully followed. JNC 7 will be completely thrown out of the window. So we have to change as per the JNC 8 now. We are in the borderline change. Okay. So like the pharmacotherapy, whenever changes, what happens, drugs will change, the guidelines will change. In a 1 or 2 years, we have to change. Okay. That's how the pharmacotherapy keeps updated by itself. So as per, somebody raised the hand. Okay. Chat also a lot of questions. Send this PPT on group, can do. And yes, we'll be able to do that, not a problem. And I think I'll just finish in another 10 minutes. And I think I'm happy to take the questions. Organizers have given some time specifically about this. I'll be able to do that. I'll just finish this stuff, and definitely we will jump in. I think a lot of people are asking questions or something. I'll be happy to take them. Okay.
Yes, I'm requesting each and everyone, if do you have any question, please type this in the chat box. So at the end of the session, we will take all the questions. Thank you, sir.
Observe. Yeah, thank you. So I'm very happy to answer all those questions. Okay. And somebody asking request, definitely we'll do that. No problems. Okay. So when you say blood pressure classification as per JNC7, we call it as normal, pre-hypertension, stage 1, stage 2. What is normal? Systolic, diastolic values are given. Below 120, below 80. That's considered as perfectly normal, and you should encourage that. And pre-hypertension, 120 to 139. It did not touch 140 systolic, and it is below 90. Now, what you should do? Sometimes lifestyle modification is yes. Drug therapy also, based on the respective, they will start. They will attempt lifestyle modification. If the pressure is not coming down, then drug therapy will be, recommended. Then stage 1, you see until 159, or it is 99 in diastolic. Yes, lifestyle and as well as drug therapy changes are needed. Stage 2, it's like more than 160. It's really high. Diastole is also greater than 100 or equal to 100. Both lifestyle modification and drug therapy, both are needed at the stage 2. You are getting basically diagnostic criteria and what you should do with this kind of with these levels of hypertension. So in the long run, if the hypertension is not managed well, what will happen? It can affect the heart. First of all, heart attack. There is a condition called cardiomyopathy, heart failure. All this can happen. Brain, we call it as cerebrovascular accidents or strokes, which affects the brain because of the excessive blood pressure, because blood vessels in the brain can rupture, or the blood vessels will be blocked. All of this can lead to this brain-related complication. Blood elevated pressure and sugar levels can also happen. Kidneys can be affected. Because of this high blood pressure, organs will be affected, and hypertensive retinopathy, eyes can also be affected. See, so many organs can be affected if the blood pressure is not managed well. I would normally say to my students, see, hypertension is a first ticket to get into next bad things. Next bad thing is like, we'll say angina, then slowly we will say the difficulty in the heart functions, and it will lead to sometimes the so-called myocardial infarction. Still we can survive, treatment is there. And finally, it will all lead to congestive cardiac failure. The whole performance of the heart will be affected. All that can start from the first one, which is hypertension. So whenever you got hypertension, people should be really aware about the complications of this disease if it is unmanaged, if it is not managed. Okay, that's how hypertension has to be managed. Generally, it is asymptomatic. You really don't get a lot of symptoms with hypertension. That's why it's got another name called silent killer. It will be very silent. On one fine day, patient will get stroke. Everybody will be talking. Oh, he's very fine. He's very healthy man. He doesn't go to hospital. He never took single tablet also. He's a very healthy man. Today, his legs and his legs are paralyzed, or whole body is paralyzed, meaning the patient is not able to move the legs and hands and unable to talk. All that that's called stroke. That can happen. Then everybody will be wondering how this could happen. When we check the blood pressure, it says like 200 by 100, it will say. Then you realize, oh God, this patient had a very high blood pressure, never checked the blood pressure, and the person is perfectly all right. Okay, otherwise no symptom. Everybody will not have a symptom. So that's how it's important. By the age of 40, please check your blood pressure. Normal advice to everybody will say, we'll tell every student, go check your parents' blood pressure once. Nothing. If there is nothing, okay, good. If sometimes it will be very silent, no symptom, but it will be 160 by 100 will do that. Then that is the time it's important to start eating lifestyle and medicines. So that's a problem with the hypertension, silent killer many times. But some patients will have like elevated blood pressure we can measure, other than headache, dizziness, palpitation, fatigue, tiredness. Fatigue means tiredness. Palpitation is irregular heartbeat. Dizziness is you feel like dizzy and cannot, a headache will be there. but it is not common with all the patients. So we cannot say you have hypertension, you will have a day. No, some people with 180 systolic and 100 diastolic also will not have any symptom. Some patients will have. Okay, but many patients with very high blood pressure, severe headache, then immediately check their blood pressure to be high. We will start treating that condition. That's called hypertensive crisis, emergency. Okay, I'm not talking about those complicated stuff in the whole slide itself because I want to keep it down. But it's not only teaching about the students, it's also teaching to patients as well as our own people. Our own pharmacy should know this is a significance of hypertension. How will you measure this hypertension? The simplest one. There is no other major technique. Only one is sphygmomanometer, which we'll use to measure the blood pressure, and also get the family history of whenever we see a high blood pressure, we'll ask whether your brother has, mother has, father has. The family history is important. And any other diseases are there. Some people may have renal failure or problem that is causing this problem. So then continuous, we will not just check once the blood pressure. We'll check multiple times, and based on that, this has to be measured. And also check whether they're smoking, alcohol, excessive sodium, and the fast food and all the chips and other stuff that have a lot of salt. That has to be checked out. What is it? Families, some families, take a lot of that pickle. This is called pickle. We like to have pickle, and that means pickle and papad in Indian food have lots of salt, because we had it for preserving the food. But that leads to excessive sodium quantity, then normally required. So that's a problem. And caffeine, coffee tea excess, and lack of exercise, very sedentary, like all the day, morning to evening, sitting in the chair and do nothing. And this is, they will work. I will not say they are lazy, they are working, but sitting in the office and working like a bank people, office people, all the time sitting, that's danger. Then stress, some kind of mental family, whatever the personal stress, that also can increase the blood pressure. So all of these are also there. We can assess along with the blood pressure measurement. Blood pressure measurement, we will check at least 2 to 3 visits. Supine means lying down position, sitting means sitting in the chair, and standing position, because in all these positions, the pressure will change. So we have to measure in all the 3 positions and multiple times, like 1 week later, multiple occasions. So in all the time, the pressure is higher, then it's only once pressure was higher, otherwise the pressure is fine. So then that is not hypertension. It should be persistent, continuous high blood pressure. Also, we'll measure height, weight, BMI, obesity, because these are all risk factors. Also measure. So this is how we diagnose and understand the hypertension. Then treatment. So first one is use and maximize non-pharmacological therapies. Okay, whatever the drug therapy we want, also ensure the non-pharmacological approaches, meaning lifestyle modification. If the person is consuming a lot of salt, you have to cut down on the salt. If the person is not at all walking throughout the day, make sure that they are walking, and have some healthy fruits and vegetables that can be taken. So finally, it's not only the drugs can help, but also lifestyle modification can also help. That's why the whole thing we have to understand. Okay, non-pharmacological treatment means weight reduction is one approach. We have to maintain ideal body mass. There is a way, it's called the body mass index of 18.5 to 25 kilogram per meter square. So there is a way to check. Please read about that in detail, and we can, that's how just students have to understand BMI. And blood pressure reduction has to be the DASH dieting. That is dietary approach to stop hypertension. What they say is you have to take vegetables, rich in fruits, vegetable, and should not be too much milk, dairy products. Too much milk is also, in the sense that paneer, cheese, or a lot of milk is also leading to a problem. Milk-related products can also lead to a problem. And sodium cut down, and active exercise, physical exercise, walking, aerobic exercise, and alcohol consumption has to be reduced or stopped. Smoking, if it is an observatory, it is a no-go. So these are all the lifestyle modification has to be done for the patient before even starting a therapy. And the sodium, smoking restriction, weight reduction, DASH diet, and weight loss. If you reduce the weight as much as 10 pounds, basically around 5 kg roughly. If you reduce 5 kg, that also will reduce the BP significantly and help your heart also. So obesity is a serious problem of this condition. Okay, this is a kind of non-drug therapy or lifestyle modification has to be understood. Then pharmacological therapy. So when there is something called algorithm, like this flow chart type will be there. Based on the type of condition, the therapy will change. That's why this flow chart is there. It is not everyone gets the same therapy. Okay, give beta blocker, ACE inhibitor, thiazide diuretic, you are fine. It is not like that. It will vary based on different criteria and condition. That's why we give some kind of flow chart. There is something called compelling indications, non-compelling indications. I'll talk about that. Compelling and non-compelling indications in the next slide. Non-compelling means you don't have a specific risk factor, like initial stages and all, and you don't have a specific risk factors could be identified. Then blood pressure is in this range, stage 1, 140, 159, diastolic in this range. You start with the drugs like this, thiazide diuretic, ACE inhibitor, a calcium channel blocker, or combinations can be given. Okay, that is how you start therapy. If it is in stage 2, then you have to give a combination, thiazide and ACE inhibitor, or ACE inhibitor, thiazide with beta blocker, thiazide with calcium channel blocker. The other one, single drug I'm telling, here use combination. Then certain compelling indications are there. Then the changes. What is a compelling indication? Means the patient is having heart failure and hypertension. Then you have to use diuretic and ACE inhibitor, then you use beta blocker, then you change. And post myocardial heart attack, after the heart attack, coronary disease, diabetes is this is that. For diabetes, you see, there's a ACE inhibitor and ARB can be. That is only this is the best drug because it will prevent renal complication caused by diabetes. So kidney disease there, then you can start initial days, you can give ACE inhibitor and ARB, but later stages we cannot use. Stroke prevention, you have to use diuretic and ACE inhibitor. So like that, you see different conditions are there. Accordingly, drugs will change. Okay, that's why you have to have an algorithm which talk about the no compelling indication and compelling indication. When we have compelling indication, it's like this, and accordingly treatment has to be given. Okay, the list generally classes are commonly used is diuretics, aldosterone receptor block. This anyway they will study pharmacology, they will understand, students will understand. Beta blocker, alpha blocker, beta blocker combinations, ACE inhibitor, and calcium channel blocker. So like that, this variety of drugs can be given, but that algorithm is a kind of guideline for this particular treatment. Okay. Then lifestyle modification, we have advised non-pharmacological, pharmacological approach. Basically, we have covered what is needed for treating hypertension. Okay. And when it comes to book, the common one to use pharmacotherapy standard, global standard, and as well as in all the pharmacy schools when they teach pharmacies and MPharms, pharmacotherapy, they will use this Joseph T. DiPiro. It's a very big book, and Joseph T. DiPiro handbook also available. The Joseph T. DiPiro book is very extensive book. There is a handbook available, which will also little simplified version can be used. And Herfindahl is more of case studies. Roger Walker is another simpler book. Simpler books means they are still they're much more complex than what normally we recommend or use it in a diploma level. But definitely now we cannot say diploma level. The expectations is much higher as per the scope of that. We cannot go beyond a particular level. Definitely, these books can be used because there is no pharmacotherapy in a very small level. It's always this level. Similar for the introductory chapters, which I was mentioning, rational drug therapy, essential drug list, standard treatment guideline. For all those initial chapters, clinical pharmacy, at least this particular book, clinical pharmacy by Parthasarathy and Milap Nahata, is having certain level of coverage. I'm not sure every 100% all the chapters are covered, but definitely this book covers a decent level of those chapters what we have discussed, rational drug therapy and all. So these are all the books, the Roger Walker, clinical pharmacy, and DiPiro basic handbook is available. DiPiro handbook. At least those 3 books are needed. In that, at least 1 or 2 books can be referred for these kind of pharmacotherapy chapter. Okay. I'll also quickly touch upon about the practical component. So practical component, if you go, they broadly talk about patient counseling. That I think it's always there, and how to do a counseling and all. I think most of the common practice, even in the previous, at least they will understand. I just want to touch upon this loop analysis based on the pharmacotherapy. So paralysis is an important component of the problem-based approach of learning. And what we are doing is for each problem, for each patient with their problems or conditions, we will diagnose or try to assess and interpret. We will understand the diagnosis, we'll assess and interpret, and finally we may have some kind of plan. Okay, this is the diagnosis of this patient. So this patient should have this medicine, like that, some understanding. Okay, what we will do, we will make a list of active problems of the patient. Then using this SWOOP approach, we will analyze and try to solve the problem. Okay, and it is in medical school, pharmacy school, medical college, everywhere it is used. The SWOOP way of analysis. I'll talk about the SWOAP in detail. It's not so what is it? Typical detergent soap or something. We'll talk about what is this acronym. It is S stand for subjective data. Okay, S stand for subjective in the SWOAP. What is that subjective? It records how the patient feels or what can be observed by the patient. Patient will complain, I'm having leg pain, I'm having back pain, I'm having cough, I'm feeling tired. So these are all the things they normally experience and they will tell to the doctor. That is called a subjective. Patient feels. It could be like something like, oh, I had a vomiting, dizziness, headache. Yes, that is subjective. Patient felt. You didn't see in the hospital when the patient coming, patient did not vomit. Patient complained that I had a vomiting and dizziness. And this is called a subjective. So symptoms, complaints from the patient in his own one is for her own words. That's a complaint. So whatever the allergy report, what is the social background, whatever they are telling. So they'll say, I'm a plumber. I used to work in this particular work, and I got this particular problem. Back pain is there. I am lifting heavy weights that is causing some kind of back pain. Something like that they are reporting. All that will be part of the subjective data. Then the next one is O, SWOAP, right? O is for objective data or objective. What is that? So this is basically measured by the clinician who are assessing, or the lab data which is measured by the lab data. So that means we can verify that. For example, physician may measure the blood pressure, pulse rate, respiratory rate, temperature. Okay, all of that they measure. So that's called a vital signs, which, and it is not patient is telling my blood pressure is 140/90. Physician measures, and there you are independently measurable. And it could be something like physical assessment. What is that physical assessment is? I would say pallor, tetanus, cyanosis, clubbing, or edema. Okay, it's called PICL in shorthand. What is? I will tell. These are all the simple terminologies, but it helps diagnose a lot of cases. Pallor means pale color. The patient is pale, meaning anemia is a possibility. Icterus is yellowish color, like in the eyes, nails, and that. Yellow color, it is possibly jaundice. Cyanosis is bluish color in the eyes, lips, something like that. What is cyanosis? Bluish color. It could be due to the lack of oxygen, meaning asthma or COPD or smokers. They will all have possibly cyanosis. Clubbing is the nail is bent. It will happen again in anemia patients and smoker patients, asthma patients, COPD patients because of lack of oxygen. Then edema. Edema is swelling of the body. Basically limbs, face, all will swelling will be there. That's called edema. Why the limbs will swell, face will swell? It could be accumulation of fluid. It could be cardiac problem, or it could be a kidney problem. Okay, just by looking, what the doctors are looking at the eyes and checking your eyes, looking at the nails. You see, the doctors will do all that. Why? They are looking for pallor, icterus, cyanosis, clubbing, and edema. It's simply called PICCLE or pickle, not that other pickle, not the lemon pickle. It's the acronym of the physical examination finding. Okay, this is also verified by the doctor, not patient is telling. That's why it's called the objective. And then lab reports, CT scan, ECG, biochemistry, all of that will become again documented, objective data. Then the prescriptions are there, medical history, the record and all given by the previous doctor, the files, records are there, you are reading. Documented clearly that you can say, yes, patient is in the past had a high blood pressure, had a heart attack, it is all mentioned here. Yes, all of this information will become the objective data. That means verifiable data. Subjective is patient tells, you can't really, I have a headache. Patient says, you can't verify, no? You can't feel, you can't, there is no measurement to measure his headache. But patient says, blood levels are lower, I feel. You can measure and verify. Oh, blood hemoglobin is low, right? So measurable and verifiable is objective. Whatever reported by the patient is subjective. Yes, oh. Then assessment. Assessment is by the pharmacist mostly. We will do the thinking, and we, based on the thinking, based on the subjective, objective finding, we'll come to the very careful plan to identify the problem. And based on that, what medicines can be given, what medicine is the right medicine, we can understand. If you don't do the prescription, physician does, but we can always check. So problem list, diabetes is there, hypertension is there. If it is there, then based on the subjective, objective finding, you can identify. Based on this, you can also understand whether the treatment is needed, drug is needed, whether the drug which is given for diabetes patient, if you are given metformin, yes, it is good. For a diabetes patient, you give a cough syrup with a lot of sugar, it is bad. Because cough syrup has a sugar, that is bad for these people. So you should give sugar-free cough syrups are now available. You have to recommend that for a diabetes person. No? Even though you say, diploma student sitting in the pharmacy, what will I do? Yes, whenever a diabetes patient comes with a cough complaint, they are giving syrup. We also, there is a non-sugar alternatives are available nowadays. The person sitting in the counter can tell, see, this is having a lot of sugar. Do you want the other? You can call the doctor. They can call the doctor. They will say, yes, please take non-sugar alternative. Yes, we can help. Even sitting in the pharmacy itself, we can help the patient. Otherwise, what will happen? Whenever they take 1 or 2 cups of this syrup having a lot of sugar, that's a problem, right? So that is how you will assess a therapy. Then new therapy may be initiated for new and old problem, and whether the therapy is appropriate, whether this is correct therapy or justification. So like that, we have to assess. The pharmacist will generally assess in the clinics, pharmacies, and that at least the diploma level students have to understand, okay, this is the therapy, this is correct therapy. If you don't comment also, no problem, at least the understanding should happen from our side. Okay, then if there are any ADRs interactions, potentially we can advise the patient and also advise the patient on why they have to take hypertension. I told, like, if you left it untreated, it will lead to heart attack long term. Okay, so you can tell any patient why it is important. See, I am already all right now. Without taking medicine only, I am okay. Hypertension will not, you have to tell hypertension is a silent killer. It is hiding in your, it is like, imagine 150, 160 and 90, any patient is asking, why I should take medicine? I'm normal. I don't have any symptom, perfectly all right. You can tell hypertension is there in your body. It is silently waiting for an opportunity to strike. And one day it will lead to a stroke. That is basically complete paralysis. Okay. So you can tell. That is why compliance is important in hypertension, diabetes, asthma. Asthma patient, don't worry. You have a difficulty, they will take medicine. But hypertension and diabetes people don't take medicine. So that why it is important, compliance. Now we will tell, the pharmacist will know, oh, it is very important. If you don't take medicine, you will get like stroke, heart attack. And then alternative therapy, we may know. If you don't recommend, still we should know, okay, particular drug cannot work, other drug. For example, ACE inhibitor will give very severe cough in certain patient, dry cough. So the patient will complain seriously. So basically, we will advise pharmacists normally here in hospital. We'll tell the doctors the patient is having serious problem with ACE inhibitor. Can we give calcium channel blocker or something else rather than ACE inhibitor? Doctor will say, no, this cough will go in 10 days. If the patient is okay, after 10 days, this drug is very good drug. He's a diabetic patient. It is important. It will save the kidney. So there is a reason why to continue. We can talk to the patient. Don't worry. In 10 days, you will become all right. Your cough will go down. And then you can, your kidney will be protected. So please, bear with us. We will try to give you some cough syrup. Like that, multiple kind of discussions will happen for one drug. Okay. That is what assessment is all about. Then last P, S. So S is subjective, O is subjective data, A is assessment, P is planning. P. Okay, it is very important. We can plan how the patient when they're going, what medicines to be given, what advice to be given, what medicines to be taken long, what should be should not take, what they should do when they are going home. All that can be planned. The pharmacist can really help in this discharge counseling. That's why the pharmacist can understand okay, some injection is there, maybe only one more day they have to continue, then we can advise accordingly. Please take the injection nearby nursing home we can take. Or is there a way to switch the injection to oral? If pharmacist knows, yes, there is an alternative medicine available, tablet is available. We can also, like at least pharmacist, at least at the bedside near the doctor can advise, see, you can change the injection to a tablet, antibiotic, something. So still there won't be a problem for the patient. So patient can be discharged safely home. It's not that doctor doesn't do all the time, doctor will do. And we can help in choosing the better brands or cost or whatever is convenient for the patient. So that way, and advise the patient what to do at home. When there is a medicine is empty, what to, how to get the medicine filled. All those will be part of the planning. So subjective, objective, assessment and planning. So that constitutes the SOAP analysis. And that is how we will teach the practical. At least 5 or 6 practical has to be done by doing all these things. I think if you have to teach the whole, so by an example, that's another day. I think the time is that already over the time. I'm already impinging on the time of the Q&A session. So, okay, that is SOAP assessment. This is a part of a practical, okay? And you know, the overall goals of treatment, whether it is attained, we will check, okay, in the planning part also. Okay. Avoiding ADRs, improve compliance, quality of life, all that has to come. And at the end, if there are any points we have to tell to the patient, we can tell, because certain drugs can have ADRs that has to be monitored, whether we have to change the therapy, all that can be advertised. Patient advice to the physician, advice to the patient, like about the disease, about the medicines, as well as the lifestyle modification, food, exercise, precautions. If there's some adverse reactions happen, what to do, all that can be advised. And then if there is any follow-up needed, according that can also be advised during the planning section. Okay, that's how the SOAP is being carried out. And you might wonder whether all this happen. Our PharmD students and MPharm students are already doing that. They are part of the system. They are working with the clinician, at least in our hospital where I work. So students will be there and they will be advising. They will tell the doctor to change the medicine, add the medicine. They will, and doctors also very receptive, because if it is helping the patient, they are okay. So that's how this is already being practiced at the hospital level. So when you look at the community pharmacy level, definitely whatever can be contributed from that side could be contributed. If not all the components, definitely certain components can be contributed by the community pharmacists if you have the better knowledge about the disease and the drug therapy. So at least we can advise and make sure that patients are getting the right medicine, and we will understand the process, what's happening to the patient. That's a role of pharmacists. I think that much level of expectation is there in the scope of this particular subject. That's SOAP analysis. Finally, what is the SOAP? It's a systematic way to predict or plan. We can always review, and if there are bad things, we can even comment about that and change. Okay, plan a drug therapy for a patient, and based on each patient requirement, we can customize the therapy. That's what will happen during the SOAP assessment plan, and pharmacists will do that. That's what we are already doing at the postgraduate level. Analyze the case, and drug therapy, and that is where we'll play. Whenever drug is there, drug therapy is there, pharmacists play a role in the best possible way. For that, the SOAP assessment of the cases is helping. That's why this is there in this practical, I think. So that's what overall picture about the pharmacotherapy, how a disease will be discussed, and on what basis the practical will be conducted. Okay. And the planning, the counseling, that's a lot of material available, and it's not a new thing. Counseling the patients on medicine, I think a lot of training program previously, and even textbooks and materials may be available on that front. But certain practicals are also there in the pharmacotherapy. Counseling on diabetes, counseling on hypertension, counseling on asthma, like that will be there. So when we have a background understanding about the disease and drugs in the initial theory chapter, that knowledge will be used for counseling. Okay, so now you can clearly say, anybody, salt has to be cut. Why? Because salt is increasing blood pressure. Why you have to reduce the alcohol? Why you have to change the lifestyle? What is the cutoff? Why you have to take medicine when the blood pressure is above 140, 90, 160, 100 is dangerous? What will happen in the long run? It will lead to heart attack or stroke. You know, all this information will come to pharmacists sitting in the counter itself. If somebody knows and they want some advice, definitely you can confidently tell, because you know the disease, you know what will happen with high blood pressure, you can clearly tell, right? That is how I think, in the counseling point of view, absolutely, I agree with that. But the intervention point of view, it will be difficult. When you are in the counter, it will be difficult to communicate with the doctor inside a clinic. But from our side, what can be done can be done. And they understand the pharmacotherapy will definitely, if you are able to understand the disease and advice, I think respect for the pharmacy profession will increase. That is, I think, overall thing they expected. And everybody, we teachers have to, lace up and, stand up to the expectation. And our students also have to live up to the expectation. So I think that's the message I want. And I thank the organizers for giving this opportunity. And I'm ready now to answer the question. Let me see the chat boxes. What is there in the chat box?
Yes, sir. Yes, sir. We will take this question and answer section.
Okay, some complaint in between, there is voice is breaking. Is that so? Is it really bad or manageable?
Yes, sir. It was manageable.
Okay. And kindly give the information about the practical making system for examination. Exam, give the pattern also. Okay. Is there any handbook of practical? There is no practical. Exam system. Sorry, I didn't specifically look into the mark. There is a mark pattern available and specific available in the curriculum. I checked how the mark will be there. We can once design a practical on this because what I understand is practical is on the SOAP analysis, then the counseling points, and the there are certain practical like measuring blood pressure and those monitoring parameters, and there is a so all these components can be broken down into practical component. Okay, there is one sub point, review of system. What should we include over there? Okay. Of the SOAP analysis, review of system is the subjective, right? In the subjective review of system, I mentioned, right, like the cardiovascular system, normal, respiratory system, based on the condition, patient complaint, cardiovascular, respiratory, renal, and hepatic system. The major organs will be mentioned normally in the SOAP analysis. That is one of the format. And what I said, the SPICIL also will touch that only anyway. So otherwise also review of the system, there is major system, respiratory, cardiovascular, hepatic, central nervous system, okay, hematological system will be reviewed. And if there is any complaint coming from that system, subjective, patient complaint about headache, okay, we'll note down. If it is like persistent, serious headache and all, note down. And patient had respiratory difficulty. So like that, where whatever the patient complains, in which system it will go added to that in the subjective data. When we analyze also, when we analyze using objective data, the clinician will focus on that system. For example, they will see for blood pressure and cardiovascular means cardiovascular evaluation, headache means if it is serious, they will do the scan. All that will happen in the objective. Based on the subjective complaints, the objective will respond accordingly. That's what the system review. How to maintain manual for pharmacotherapeutics. Manual, I mean a record, practical record we are talking. That's what I mean. I think the manual means a record we have. Usually, I think 12 or 13 records are there. That is, they told us 6 on the SOAP analysis. So 5 or 6 on counseling, and few other records. Like that, around 13 to 14 records are there. The SOAP analysis record is we have to have a case, model case will be there. There will be a, I think that needs a different teaching also. So the case profile is there, that will be there. And the SOAP analysis will be there. Subjective, what is evaluated, objective, like this, all this evaluation. Finally, what is a recommendation for that therapy? Counseling points. All that will constitute one practical, case. Then second case, maybe diabetes case, maybe asthma case. Like that, we will have 6 different cases for using this SOAP analysis. Then counseling. Counseling means counseling points will be there. So you will counsel on the, the counseling normally talk about the disease, lifestyle modification, about the disease, about the lifestyle modification, about the therapy, the drugs. This is how the structure will be there for counseling. There is a way and very structured approach is there. That will form the second set of experiment, 5 experiment. Okay, we will say counseling for the hypertensive patient. You hypothetically given that you can take any prescription which is coming from the pharmacy also. Okay, hypertensive patient is having beta blocker, AC inhibitor, and some thiazide diuretic. Some other medicines are also there. Then now what you will counsel? So we have to start with the disease actually. For that hypertension, what is the hypertension? Why the hypertension is coming? You can tell along with the, your blood pressure vessels have become stiff, that is why pressure, and also salt, alcohol, smoking, or the risk factor will contribute to hypertension. And what are all those will become the initial introduction about the disease. And if, for example, that particular patient, even hypothetical patient had a family history, you can also say the patient had a family history, that's why the patient is having hypertension, possibly having hypertension. Like that, we'll finish about the disease. Then we talk about the pharmacotherapy. So what drugs? Okay, they've given AC inhibitor. We can say AC inhibitor is helping to reduce the blood pressure, and it has to be given in this particular doses. And AC inhibitor in the initial stages can cause the dry cough. After some time, it will go down. Okay, they've given thiazide diuretics. How to be given using diuretics? What are the adverse reaction to monitor? That is for drugs. Doses. What doses is given? 1 tablet a day, 2 tablets a day. All those information as per the prescription. And finally, lifestyle modification. Then you talk about the so many things: weight control, salt, DASH diet, smoking cessation, alcohol cessation, exercise, moderate exercise. All this can be advised in that section. All this put together is called a counseling experiment. Oh, like this is for diabetes, then for asthma, then for different diseases. Like that, we can do for all the diseases, 6 experiments. And then 2 more experiments are there. I think few other additional points. That way, 12 or 15 experiments will be conducted. Students have to write the same. Same cases we can give, let them write the same cases. Here, what we do at the PG level, every student will have their own case. They will go to the hospital, take and present, and then they will write. Here, we can give the same case background, and give the counseling point. That point they will have to write. So exam also we can give similar cases or same cases and ask the student, can you write about the lifestyle modification, about the disease, and the pharmacotherapy related advice for the patient. So they will have to write all about this, and you can ask even viva on those. Why you are advising salt restriction? Why you have to avoid the highly glucose food in diabetes, and why the patients in diabetes are getting the thirst? Why there is something called urine glucose will be higher. That can be tested actually. There is a test available. Why urine glucose is available higher in the diabetic patient? Like that, multiple questions can be asked during viva. So that's how the practicals have to be managed. Theory, as I mentioned, the one example, this is not the classical example. There could be multiple variations are possible, but broadly on this line, what the syllabus is expecting, that much we can prepare. Okay, that is how each disease has to be prepared. For all the, I said, at least 13 sections and easily 50, close to like 50 diseases, 40 diseases are there. All this has to be treated accordingly. Okay. Do we have a document the patient counseling in a question answer format like discussion? Not like that. You can ask a question answer type. We don't have to say like what patient asked and this one. You can ask a question as a teacher. No, okay. This patient has to be counseled. Patient also had a few questions like this. Like that, we will give it in the question format. So please write about the risk factors for hypertension. Okay. This patient has this is risk factor, smoking, he's a smoker, he's taking alcohol, he likes pickle, and these are the blood pressure level. Now, advise what are the lifestyle modifications. He is a bank person, he's working in the bank. So based on that, now advise the lifestyle modification. Then last one, this patient has this drugs, X, Y, Z. Now counsel about the drug. Like that, we can ask a question. The question will be longer. Okay, it is not like counsel the hypertensive patient. You have to give all this information, 3-4 questions. Then they will write each section in detail. Okay, so that's how the questions can be asked. So question is not one-liner. Counsel a diabetic patient. No, we cannot give. You have to tell who is the patient, what is the risk factor, and what is the background about the patient. Now you counsel about the disease, medicines, and lifestyle modification. Like that you can ask, and they will, based on the condition, he will tell, okay, this patient is a hypertension. He's a banker. That means he's sitting for a long time. So we will advise exercise every day, morning and evening. He should walk certain for the certain time. Then he likes a lot of pickle, and he says food and all is adding this one. Accordingly, food has to be, salt content has to be reduced. He says occasional some parties is attending and having some alcohol, that has to be reduced. And smoking, he's a smoker, he says. He said, son, you have to talk about the smoking cessation. So by patient like that, the student have to be right about that. Okay. So we have to train them during the class session on all this. So they will, in the exam, they will be ready. So that is how all these components has to be handled. For the record, you can make it as a question answer format. Right, that would be a little hard, the discussion, like what patient asked and all. So rather you will, from the patient point of view, what are the questions and background we will provide in the beginning. Let them write in the record that way only. Exam also, you do the same style. Ask the same question. Let them same question. There's a similar style of question with same type of patient. Let them write about the counseling points. Okay, like that. If you do it the same way in the class, exam also asks the same. It will be easier. Here we more like discussion we can write, but in the exam, if you ask a question, it will become difficult. So let us train them in the same way, question answer format only in the class. Same thing you ask in the exam. Similarly, you give a background SOAP information. You say, please write the simple SOAP information, SOAP analysis. So they'll say subjective. This patient is complaining that that thirst and what is a polyuria, something is there. So they complain. That is subjective. This is a sign for the diabetes patient. Asthma means they will complain, or respiratory difficulty is there. Okay, that is. So objective, we measured like that. That has to be the same way we want to conduct exams, same way the practical has to be conducted, same way. That makes life easier for the student when come to final exam, because these are all really advanced and complex topics. So for learning, we will have to conduct it the same way in the class as well as the exam. So that makes life easier for us as well as for the students. Okay, keep the exam in mind and teach the practical. Theory also same way. Theory also, if I look into the DPRO book, like for hypertension, there is 100 pages, huge chapter is there. But we have to simplify and focus on the key aspect. That's why I said there is a handbook on pharmacotherapy is there by same DPRO. That will be much simpler than the big book, and that can be referred. And I'm thinking over the coming years, books may come for pharmacotherapy. We can. Okay, that's what I have to say. Any other questions? I'm ready.
Yes, thank you, sir. Dear participants, any other question from your side? Okay, sir. This session was very much informative, and on behalf of entire committee members, I want to thank you for your excellent presentation, as well as you have shared a lot of information with respect to pharmacotherapeutics, not only theory aspect as well as the practical aspects. You have also shared various textbooks which are specifically used for this subject, and all are very much useful for all the participants. Definitely, they have got very good information from this session. So thank you very much, sir.
Thank you, madam. Thanks all the audience and organizers for being with me. Thank you. Good day.
Thank you. So we will have the second session. Welcome, Ranjit sir. Ranjit sir, am I audible? And also inform Mansoor sir. So all participants, you can take 10 minutes break, and we will start sharp at 12 o'clock. Good afternoon, everyone. Sir is going to join. Also, sir. Good afternoon, Ranjit sir. Sir, you are not audible. Ranjit sir, there is some issue. You are not audible. Yes, sir has joined. Sir, Ranjit sir, there is some issue. You are not audible. So, good afternoon, everyone. So, now we will start with the orientation on subject hospital and clinical pharmacy. So for this, we have invited Dr. Kuldeep Bansal as well as Mr. Ranjit Ade sir. So before we start this session, I would like to introduce Dr. Kuldeep Bansal. Uh, Sir has completed his B Pharmacy in 2006 from the Sudhar Naik Institute of Pharmacy, Husar, Amravati. He has completed his M Pharmacy in 2008 from University Department of Pharmaceutical Sciences, Nagpur. Then he has also completed his PhD from University Department of Pharmaceutical Sciences. He has received CSR fellowship. There are various awards he has received. His GATE qualified IIT Kharagpur in 2006, then CSR fellow, then Surya Kumari Best Paper Award during IPS 2010. He has also mentored 38 students in 2020-21. There, he is having vast teaching experience. So earlier, he was working as assistant professor in pharmacology in 2008 to 2010. Then he was working as a lecturer in 2011 to 21 in Government College of Pharmacy. Now he is in the till date he is in the Government College of Pharmacy, Karad, and there are very vast research experience he is having. So there are around paper published international 12, national 3, presentations around international 1 as well as national 4, 5, and reviewer. There are various journals he is reviewing now, and books around national 6 books he has published. He has also invited for various talks. So resource person in FTP 51, guest speaker 55, and webinars 10. He is having associated with lifetime member of Indian Pharmacological Association, and he has also received various grants. So we will welcome Dr. Kuldeep Bansal sir for this session, as well as we are also welcoming Ranjit Ade sir. So yeah, so before we start this, also I would like to introduce Ranjit Ade sir. His designation as lecturer in pharmacy, and he's having around 13 years of experience, from which 1 year in manufacturing, 3 years in marketing, and 9 years in academics. He has published 5 research and 5 review articles in various national as well as international journals. He has also awarded by Healthcare Leadership Award in 2021 by Healthcopia Wellness Private Limited, supported by Indian Pharmacopoeia Commission, Ministry of Health and Family Welfare, Government of India, for excellent contribution in pharmaceutical education and research. Sir is also a member of Western Regional Center Association of Community Pharmacists of India. He is also running one NGO and actively participated in various social activities. So we all are welcoming Dr. Kuldeep Bansal sir as well as Ranjit Ade sir. So I'm requesting Dr. Kuldeep Bansal sir to share his experience as well as he can start his session. Yes, Dr. Kuldeep Bansal sir.
Hello, thank you everyone.
Yes.
Thank you all dear participants. Today we are here to learn more about what are the different changes that takes place inside the subject hospital and clinical pharmacy. Let me congratulate first all of you that we are here to implement the new education regulations 20 implemented by Pharmacy Council of India. There are certain changes takes place in this new education regulation. Some of the subjects are new to the syllabus. They are also new towards us faculty members. But looking toward the hospital and clinical pharmacy, the same subject is also present in a previous education regulation 91. But now here, there are n number of the changes are takes place in the content of the syllabus hospital and clinical pharmacy. And definitely, we together will chunk out what are these changes and how to implement these changes inside the curriculum. Through this learning dialogue, we will achieve the various learning objectives like identify the competencies for the diploma in pharmacy holders in the India, then describe the changes in syllabus, particularly giving focus on the HCP, map the course outcomes with the syllabus as they are also given by the Pharmacy Council of India, describe the practical included in a HCP and review the changes to meet the demands and achieve the competencies inside the students. All we are aware that the new education national policy 2020 is likely to be implemented by the government of India in 2025. In the preamble of the national education policy, inside the vision statement, it is clearly mentioned that each and every institute has framed a curriculum, develop a pedagogy to implement that curriculum. The assessment of the student should be fair so that it will be reflected inside the student's report. So with these objectives, the National Education Policy 2020 implementation is going on. Recently, if everybody is aware, NSQDF is also published by the government of India. In the same way, according in the line with the National Education Policy, the Pharmacy Council of India in the year 2020 also has a one clear-cut objective. The pharmacist, the student who is passed out after taking the diploma in pharmacy, who is not only the dispenser of the medicine, but we can call him as a medicine expert. The medicine expert is a huge terminology that contains a number of the things that we will look one by one. So it is the prime objective, prime focus of the Education Regulation 20 for the diploma in pharmacy course that the student who is passed out the diploma in pharmacy course should be an expert in the medicine. This curriculum is framed by giving the various scope, course objective and the course outcome so that student will know why we are going to learn this particular subject. What are the objectives that will be achieved after completion of this subject? These are the various competencies given by the Pharmacy Council of India in the Education Regulation, and they are mapped with the hospital and clinical pharmacy as shown here. All the competencies, if you look at review prescription, patient counseling, expertise in medication, delivery of primary and preventive health, like up to 10, continuing professional development, every competency is get mapped with the content of the hospital and clinical pharmacy. My dear colleagues, there may be the chances some of these competencies are clear-cut mapped inside the theory. Some of them are mapped inside the practicals. I am here to tell you or to discuss with you more and more about the practicals. So all of we know that the course code which is given by the ECI, it is the ER 2025 EP for the practical, and the code which is given by the MSBT is 20060. The difference in the previous year and this year is, in the previous year, the hours which is allotted towards the practical of the hospital and clinical pharmacy is 2 hours. Now in this year, there is only 1 hour is allotted towards the hospital and clinical pharmacy. So many of our colleagues are in question how to complete the practicals in 1 hour. So it is a tedious job and it is a jumbling for us also. Not only the hospital and clinical pharmacy, but also the therapeutics that has to be completed in a 1 hour only. So it is a very hard task for us to complete the practical within 1 hour. So we have to complete it. So this is the main difference. The scope of these hospital and clinical pharmacy states that it is designed to train the student to assist other healthcare providers in the basic services of hospital and clinical pharmacy. Remember what the scope tells? Scope tells that he should be an assistant of the healthcare provider. Like he should be assistant toward the nurses, he should be assistant toward the physician, surgeon. In what? In the basic services, not the services which require the very dynamic skills or the surgical skills, but the basic skills which are needed for taking care of the patient or for the pharmacy practices, that should be inculcated inside the students through this hospital and clinical pharmacy. My dear colleagues, if you have any doubt, please feel free to put the messages inside the chat box so we can address them at the end. So the scope tells you have to perform the basic services that meets the patient care. According to this, the course objectives are framed that are also given inside the ER. I am directly goes with the course outcome. But course outcome says the first and foremost course outcome is professionally handle and answer the drug information queries. In India, there are near about 7 drug information centers all over the India. all the pharmacy councils are now opening their own drug information centers. If a pharmacist is working inside the hospital, some of the hospitals are also working as a drug information center. Moreover, if a pharmacist is practicing inside the hospital pharmacy, he has to deliver the various information toward the patient, pharmacist even, nurses, and the physician. So he must know if the query is asked by the physician, maybe it is in the oral, written, or in the digital form, how it should be addressed. Then interpret the common laboratory reports, not the differential or the advanced laboratory reports, but the common laboratory reports like the CBC count, content of the urine, some content of the blood, like cholesterol content, like lipid profile, like some respiratory related laboratory test. Such a test should be interpreted vigorously by the hospital pharmacist. The third course outcome is report suspected adverse drug reaction using standard procedure. He is able to identify whether this side effect is a common one or it is only appearing inside this patient. If this effect of the drug is hazardous toward the patient, then definitely it should be recognized as ADR and it should be reported toward the IPC in the given format of the IPC. Our students should know what is the procedure to recommend or what is the procedure to send the adverse drug reaction toward the IPC, Indian Pharmacopoeial Council. If we tell them the different methods, if they are gone through a demo process or the process in the future, they will be confident enough to report the ADR. The CO4 is understand the uses and methods of handling various medical surgical aids and devices. This is the basic requirement so that he can be an assistant inside the various procedures of the patient care. Course outcome fifth is interpret and report the drug-drug interaction in common diseases for optimizing the drug therapy. So he should advise toward the physician that there may be the chances of the drug-drug interaction if he found something. So with these course outcomes, the various practicals are framed. And for these practicals, some of the basic requirements are written over here. What do you require? You require a desktop computers with the internet connectivity. Without this, or student can also able to search on the mobile phones. But if the desktop is present, then 2 or 3 students can think critically and work accordingly on the desktop computers. So this is the primary requirement, that laboratory should have the desktop computers with the internet connectivity to search for the various resources to find out the answer. Then drug information resources, including the reference books. So all my dear colleagues, you know that the drug information resources are divided in 3 classes: primary, secondary, and tertiary. To search that resources, they must be present. They must be having the license authority inside the library, or you can choose the different methods to search out the various resources. Then different types of the surgical dressing to give the demonstration toward the students that we will see in each and every practical. Medical devices like a cervical collar, kneecap, and the accessories like Ryle's tube, IV set, needles, syringes, colostomy bag, etc. etc. You should have the various charts, models, and exhibits how to use these various types of the instruments, devices, and the accessories. And lastly, the mannequin is very much important to practice how to give the intravenous, intramuscular, and subcutaneous injection towards the patient. For other demonstrations also, like demonstration for the Ryle's tube, we require the mannequin. So mannequin is a must. Mannequin is also required in the other experiment, like in the first year social pharmacy also, in the community pharmacy also. we require the mannequin. So this is the basic general requirement that required to conduct the practicals of the hospital and clinical pharmacy. On the same, we have published a book, Laboratory Manual of Hospital and Clinical Pharmacy, through a Trinity publication, and that contains the various experiments. The first and second experiment is on systematic approach in handling the drug information queries. By this experiment, the students will able to create a response for the drug information queries following systematic approach. That is, there is a 5-step approach to answer the drug information queries, which is given by the IPC, Indian Pharmacopoeia Congress. And how to give the information? By searching for the primary, secondary, and tertiary information. If the pharmacist has the information, he can put that information in that 5 steps and then send it back toward the requester, or he has to search for the various resources, gather the information, frame the response in the 5 different steps, and then send it back toward the requester. What you require for these experiments? The drug information query. The query which is required. Now, in our manual, we have given a case that some scenario is there, and according to that scenario, we have created a one person, like a pharmacist, like physician, or the nurses, or the patient relatives, and they are asking toward the drug information center that we have these queries. And now student has to think on the scenario that given inside the case and write down their response in a different 5 steps by searching for the primary, secondary, and tertiary resources. So we require the query, means the case, then primary, secondary, tertiary drug information resources, computer and internet facility to go for the wide search, so that student will able to know how to search. So that capability should be inculcated into them, how to search. After searching, where we have to believe on the information, whether the information is true sources or the untrue sources. So that will be inculcated inside the students. By these experiments, if the students go through these experiments, the critical thinking ability will be automatically inculcated inside the students, and they can write their answers step by step from the case. The next experiment is 3 and 4 that are depend on interpretation of laboratory reports to optimize the drug therapy. So there are some reports we have given as a case inside the practical, or teacher can give the reports from the laboratory also. They can have the second copy of the report inside from the laboratory, and they can given toward the students, and student has to write the answers searching on the internet to optimize the drug therapy. In our practical cases, we have given a case with the drug treatment along with the laboratory reports, and pharmacist has to think on whether the drugs that are given toward the patient, whether they are correct or some changes are required. So he has to give the information toward the physician. So the critical thinking ability and writing the answers toward the physician should be developed in these practicals. The experiment are 5 and 6. They are depends on the reporting of adverse drug reaction in the IPC ADR reporting form and the casualty assessment. The casualty assessment, there are the 4 different steps. That 4 different steps according to IPC that are given inside the experiment. The ADR that should be reported so that the others are cautious while dispensing or while prescribing same type of the medicine toward the patient. So for this, you require a case. The case is given inside the practical. More cases are also present on the drive in the coming days. The next experiment, that is experiment number 7, is a demonstration of kneecap and the cervical column. The main aim of this experiment is to learn the technique of wearing a kneecap and the cervical column. First, pharmacist must know how to wear, what are the uses, what are the precautions that should be taken, so that when a patient is asking for these cervical collar or the kneecap, they will able to know why it is prescribed for us, why it is given to us, what are their benefits, what are the drawbacks if they don't wear this. So all these information should be given by the pharmacist toward the patient, and pharmacist should also tell them how to wear it proper. In short, we can say that pharmacist should know the SOP of wearing the kneecap and the cervical collar. Not two types of the cervical collars are there, soft and hard. So which is suitable? How to measure the length of the neck, how to select the particular size collar, how to select the particular kneecap. There are various types of the kneecap, like functional, like a rehabilitative, like a supportive. So which kneecap is good for the patient, that will be selected by the pharmacist. In this practical, the student has to play a role. So activities are added in this practical from our side. In that, they has to perform the various roles, and by this role, they will able to counsel the patient that in this way you have to wear the kneecap. What to do when you are sleeping, whether you have to remove the kneecap, whether you have to remove the cervical collar or not, that information is given in this experiment, and that they have to tell toward the patient in the role play. In the same scenario, there is experiment number 8, which is on the orthopedic belt. There are different types of the belt, like a lumbosacral belt, orthopedic belt, abdominal belt, hip belt, some chest belt are there. So this type of the belts, how to use, how to select the particular size on the basis of the patient condition. What precautions should be taken when we are walking, when we are sleeping, when we are running, when we are working, whether we have to remove the belt or whether we have to loosen the belt or the tighten the belt when we are particularly doing some activity. That all information is inculcated in that experiment number 8, and student has to play the role. By playing the role, they will demonstrate how to wear the belt at the appropriate position, in appropriate manner. The experiment number 9 is on the demonstration of walking aids. There are different types of the crutches are present. There are given inside the figure, like armpit crutches, walking frame, canes are there. Different types of the canes are also available. Forearm crutches is there. Then walking sticks are there. So all these, how to use, which is suitable for the patient, which is used in which condition. What happens if patient use them wisely? What are the benefits? What are the drawbacks that are taken in this experiment? And the precautions that are necessary that should be given toward the patient. The experiment number 10 is on demonstration of different types of bandages. The bandages that may be useful when there is a first aid that save the life of the patient, so that the students, after performing this experiment, the students are able to learn about different types of bandages and the techniques to apply these bandages on the patient. So various techniques are there, like a reverse spiral bandage, in a 8 bandage. So we have to form the 8 of the bandage by tightening it. Then bandaging, how to bandage the figure, how to bandage the elbow, how to bandage the forehead. So different types of the bandaging technique are there. The student will able to know which bandaging technique is good in which types of the patient condition. So you should have the splint for this. You should have the bandage, so that students will perform the demonstration on the others. Experiment number 11 is on the demonstration of the needles and the syringes. All of you are very well aware that there are different types of the needles are available to give the different types of injection. So another role of the hospital pharmacist is also the dispensing toward the internal departments of the hospital, so that on the basis of patient condition or the operation, he should know which type of the syringes and needles are required in the OT or are required by the nurses or the physician. So he will be a very much familiar toward this such a type of needles and syringes, and he should ensure the timely distribution of the parenteral devices. For this, experiment is included. The experiment number 12 is a demonstration of the intravenous sets. So after going through this experiment, student will learn about the various components of the IV sets. What is mean by the drop rate? So there is a one drip chamber. There is a micro drip chambers are also available with the IV sets. What is the use of them? How to calculate the flow rate? How to maintain the flow rate when the any drug is administered by taking the vehicle of the sodium, normal saline or the dextrose? What should be the flow rate and how to maintain that flow rate from the drip, from the drop volume? That is included in this practical. So student has to calculate the drip rate for particular flow, of the IV infusion. Then experiment number 13 is the demonstration of the Ryle's tube. All of you are very well aware about the Ryle's tube use. They are used for the intragastric technique. So for this, you require the mannequin that is built for the demonstration of the insertion, administration of the Ryle's tube inside the patient. So that the pharmacist must know how to use the Ryle's tube. So he will assist toward the physician while using or while putting the intragastric Ryle's tube. The 14th experiment is the demonstration of the oxygen mask. Different types of the oxygen mask as shown in the figure, like non-rebreather, simple, high flow nasal cannula, then BiPAP, oximizer, nasal cannula is there. So different oxygen masks are there. They supply the oxygen. At what flow rate oxygen is supplied, and the timely distribution of this oxygen mask toward the operation theater or toward the emergency room, it should be ensured by the pharmacist, and hence this practical is included inside the laboratory manual. Then experiment number 15 is for the demonstration of the catheters, urine bag, and the urine pots. So all these are very much important for the patient care when the patient is a bedridden. The catheters, different types of the catheters, how to insert them. If you are able to demonstrate the insertion of the catheter with the help of the mannequin, it is very good, so that the student will aware about the insertion of the catheter inside the patient. So have the mannequin, maybe female mannequin or the male mannequin for the catheterization. Then the urine bag, there are different types of the urine bag, 1 liter, 1.5 liter and the 2 liter. At least keep the one urine bag so that the student will know how to measure the urine output of the patient in the 24 hours, in a 6 hour. There are the markings are present on the urine bag, how to measure that, where it should be hang, whether they have the hanging tip or not, so that the student will able to know and distribute them inside the hospital. Then urine pots, what are the uses of the urine pots, whether the different forms are available or not. So by going through these experiments, student will able to handle the catheters, urine bags and urine pots wisely to take the patient care. Then experiment number 16 is on the demonstration of colostomy bag. There are different types of the colostomy bags, and the procedure to use the colostomy bag is given. What happens toward the patient intestine and when the colostomy is needed, and what is the use of the bag is there. Which patient should use the bag, how to wear the cloths onto the bag, this should be demonstrated toward the patient, so that the more and more patient care and information is delivered toward the patient. Then experiment number 17 and 18 is on the drug-drug interaction. So there are the cases are given in which the drugs are prescribed. Maybe there are some past prescription is also available with the patient. On the basis of that, pharmacist has to find out whether there is a drug-drug interaction that takes place or not. If there is a drug interaction takes place, then he has to suggest the physician to change the medication. So the case scenario is given inside the manual. To search this the student has to use the various types of the applications inside the Android mobile phone or on the desktop computers of your institute. They has to search for the drug interaction, like some softwares are given inside the manual also, like Lexicon, Medscape, WebMD, clinical trial, and the literature data from the different literatures like Science Direct, PubMed, or the Scopus even. Also, the drug index is one of the apps that each teacher should have in their mobile phone now. I'm again repeating the drug index. This is the app that you should install in your mobile phone that gives the huge number of the data with the available medications inside the India. What are the indications, where they are used, what is the mechanism, what are the uses, side effects, adverse drug reaction, what is the dose for the pediatric, what is the dose for the geriatric, what is the dose for the pregnant woman. Every inputs for the drug is present on that app, that is drug index. So install that app and do a tremendous inside the hospital and clinical pharmacy as well as in the therapy. In the therapeutics, you will definitely love that application, drug index. The experiment number 19 and 20, they are on the wound dressing for the forehead injury and the knee injury. These two are particularly taken because where the patients are having the maximal pain. You can't say as that, but for picking, if you able to know this, the wound dressing of the forehead and knee injury, then you can able to dressing of any type of the wound. So for that, we have included a role play activity inside the manual. So you must have the bandage, and student has to play a role and demonstrate how to wrap the bandage. What are the different steps? What do first? What do second, third, fourth, fifth, and then wound the dressings of the forehead. So with the help of role play, they can perform this activity in the 19 and the 20. The experiment number 21, 22 to 24 requires the mannequin because they are depend on the intravenous infusions and the injections with the different routes. So student will select the needle and the syringe and practice the administration of the drugs on the mannequin so that they can have the good hand of the administration of the drug. How to select the site for the injection, intravenous infusion, how to select the flow rate, how to put the cannula, how to put the needles. So all these are demonstrated in this experiment. Various steps are given. Experiment number 25, that is the last experiment, which is I love very much because students also have the very fun in this experiment, because one free software link is also given in this practical. That software is called Hospital Pharmacy Software. In this software, all the information of the hospital as well as the hospital pharmacy is included. What student has to do? Student has to admit a one patient and they have to generate the report. If they admit the patient, there is a one report is generated for the admission of the patient in the hospital. Then assign a one role toward the physician or toward student for the physician. Then the student become the physician who can put the entry, assess the patient, put something diagnosis inside the application and write the prescription. Then he can have the printout of the prescription. Then this prescription goes toward the pharmacist, assign the role of the pharmacist to one of the students. Then pharmacist will check the prescription which is coming online to him. He will add the entry and dispense the medication. Before that, assign one role toward the student for adding the medication. So medication will be added inside that software so that the inventory will get generated. When the prescription is comes, he will dispense that automatically. The same amount is get deducted from the inventory so that the whole scenario will be seen by the students. How the patient is admitted, how the patient is discharged, which documents are generated, how the bill is generated, how the patient records are saved inside the cloud. All this information is handy for the students by this demonstration. So this practical is very much interested so that student will aware about the various various functionality of the softwares. So in the previous year, we have taught the students about the application of the computers inside the pharmacy, inside the hospital pharmacy, that are theoretical one. Now with these experiments that are a practical one, so that students have the experiences of going through the practicals. So in this way, as per the curriculum need, we have designed all the 25 experiments, and all these 25 experiments are completed within a maximum 1.5 hours. So it is a very much easier to all our colleagues to implement the hospital and clinical pharmacy with these practicals. So with these practicals, I think that our pharmacy students will be a more and more focusing on the patient care, not only toward the dispensing of the medication. And so that the objective of the ER 2020, that is, student will be a medicine expert that will be goes on fulfilling. So this is all from my side. If you have any questions or handing toward the organizers, what they have decided. Some questions are there. Is the app India Drug Index? Yes, sir. Thank you, Thorat ma'am. Thank you, Jagtap ma'am. Is any other questions?
Yes, sir. We will have question answer session. Yes, all the participants, I'm requesting if you have any question, please write it down in the chat box.
How to conduct practical regarding ADR? Adverse drug reaction, sir, what we have included inside the manual, we have given one case. On that case, there is a reaction of the drug, side effect of the drug, which is hazardous toward the patient. And the form is given inside the manual, that the form which is given by the IPC, and student has to fill that form according on the basis of that case, so that they can have the practice of filling the adverse drug reporting form. Okay, sir. Suresh, sir. Thank you, Golab, sir. It's a long time meeting you, Golab, sir. Which
Sir,
manuals is used for practical?
Practical and which publication?
Karan Bapte, sir. Sir, all these are included inside the Manual of Hospital and Clinical Pharmacy published by the Trinity Publications. If you are able to see on the screen.
Yes, sir.
Thank you, Gaikwad sir. Thank you, Pooja ma'am. Anson sir. Karan sir. Ma'am. Anupama ma'am. Thank you for your nice comments at the chat box.
Thank you, sir. So this session was very nice and very much informative. I hope all participants must have got very good information with respect to this subject, because as this one is one of the news, even if it is old subject, but yes, there are n number of changes as per year. But sir has simplified each and every experiment in detail, and he has also spoken about how to conduct that practical in detail. So, sir, thank you very much for addressing all the queries with respect to participant as well as this subject. Thank you very much, sir.
Thank you very much. Thank you very much, dear participants.
Thank you, sir. So, all participants, we will have next session of the same subject, hospital and clinical pharmacy. And I'm inviting Ranjit Ade sir. Sir, will you please hand over this session?
Yes, very good afternoon, madam.
Yes, sir.
And very good afternoon, all the respected principal and lecturers.
Good afternoon, sir.
Yes. So, the session which was delivered by Dr. Kuldeep Bansur sir, yes, this is really very informative with respect to the practicals. So now I am going to cover the theory part of this hospital and clinical pharmacy. Okay. So, yes, my screen is visible to all. Yes,
Yes, sir. Yes, sir. Yes, it is visible.
So, D.Y. Patil deemed to be University School of Pharmacy, Navi Mumbai, in collaboration with Indian Pharmaceutical Association, Community Pharmacy Division, and Western Regional Center Association of Community Pharmacy, Pharmacists of India, organizes 2 days online faculty development program. That is orientation on hospital and clinical pharmacy. Yes, as the Kuldeep sir said, that our student must convert or must move from traditional our product oriented approach, that is the dispenser. Our pharmacist is just like a dispenser, but now we should have to make it a medicine expert. That is the patient oriented approach. Our pharmacist should move from the product oriented approach towards the patient oriented approach, so as to ensure the maximum well-being of the patient while on the drug therapy. So for that, the Pharmacy Council of India make us so many changes in the syllabi of hospital and clinical pharmacy. So we'll see which changes are made by the Pharmacy Council of India in ER 2020. Yes, as we while teaching to our student, we feel that this syllabus is having so many it is having so many we are not able to make our student to as a patient oriented. We are not able to give the patient oriented approach to the patient, to our student. So to fulfill this gap, our Pharmacy Council of India was launched this year 2020. So we are going to cover the first of all this hospital and clinical pharmacy theory part. First, the name of subject, that is hospital and clinical pharmacy. Then a subject code. Yes, while documentation in our day-to-day documentation, we required these things. The subject code as per PCI, this is ER 2025T. And if practical is there, then this is 2025P. MSBT code, this is HCT 20225. And the program code or year code and scheme, that is PH2J. This is the J scheme. Okay. And this is for second year. So that's why 2. P stand for the PH stand for the pharmacy. Then competencies. Yes, everyone talk here about the competencies. So which skills should have to develop, which knowledge, attitude should have to inbuild or develop within our student while learning these subjects. This is very necessary. So that's why everyone, when we come here and we talk about the competencies, and these competencies are given in our ER 2020. So what are the competencies? Competencies may be defined as this is the composite of knowledge, skill, attitude, and the value that is essential to the practice of the profession in the real life context. So if these competencies are developed, then our student, when gain all the knowledge from all the subject, develop various skills, develop its attitude with the values, then our pharmacist can properly work in this society, serve the society. First, review of prescription. Yes, this hospital and clinical pharmacy, as already Dr. Kuldeep sir said, that our hospital and clinical pharmacy, this subject is mapped with each and every competencies which are given into the ER 2020. Yes, madam, may I audible? Okay. Yes, may I audible to everyone? Yes, someone please give me the response. Yes, may I audible or not?
Yes, sir, you are audible.
Yes, okay, okay. Okay, so our hospital and clinical pharmacy, this subject is mapped with each and every competencies which are given in the ER 2020. So when I saw the ER 2020, then in a proficiency on, this is not mapped with the one part, that is a proficiency on drug and pharmaceuticals. This is not a map with this competency, but I thought our HCP is mapped with each and every competencies which are given into the Indian pharma, which are given into the ER 2020. Okay, now let's see the course objectives. Course objectives are nothing but by keeping some vision and objectives in front of us, we are teaching our student. So which things they have to gain after the completion of this subject, and with which objective we are teaching them. So while teaching our student and while learning by the student itself, again, they should have to keep the objectives of the course in front of their eyes. While studying this subject, which objectives I have to gain from this subject, that how to keep in front of his or her eyes, and accordingly they have to learn the subject and we have to teach the subject. So first, hospital and hospital pharmacy organization and setups. Is somewhere our earlier syllabus is lacking in the organization and setups of the hospital pharmacy. We are having the hospital chapter in the earlier syllabus, but this is now removed from the ER 2020. But we are having a hospital pharmacy chapter, but while teaching a hospital pharmacy, we should have to cover the hospital chapter. Means we should have to teach the student what is hospital, what are the different functions are performed by the hospital, then how they are classified, what are their objectives. Okay, then the student are better understand the hospital pharmacy. So first objective for us is the hospital and hospital pharmacy organization and their setups. So after the completion of this course, students are able to organize their own setups. They are thinking to establish their hospital pharmacy or their own pharmacy even. Then second objective, basics of hospital pharmacy services, including the procurement, supply chain, storage of medicines, and the medical supplies. While when students are passed out from the diploma institute or after the completion of diploma, so many students are not aware from where we have to procure the drug, who is the who is the primary supplier, secondary supplier, and who is the tertiary purchaser. Okay. So they are not aware from where they have to procure the drug. What are the who is the wholesaler, who has C&F? Okay. So then supply chain, how the supply chain is built, and how we'll get a product within a given period of time, how we'll get a services immediately. Then storage of medicine and medical supplies. This is a very important part of the hospital and clinical pharmacy. This is where while running the hospital pharmacy, we must able to procure the drug. We are aware about the supply chain to get a product in a given period of time. Then we should have to store the medication in a proper storage condition to maintain its efficacy, and medical supplies. Okay. The next objective is basics of clinical pharmacy, including introduction to the comprehensive pharmaceutical care services. So to identify various adverse drug reaction, drug-drug interaction, drug-food interaction, or any incompatibilities in a prescription, we are aware about the clinical pharmacy. We are aware about the various terminologies. We are able to counsel the patient. So our product-oriented pharmacist should have to move towards the patient-oriented, that our pharmacist should have the patient-oriented approach. So for that, our pharmacist should be aware about the clinical pharmacy and the various pharmaceutical care services. And what our pharmacist is also aware about the various poisoning which are takes place due to the drug, toxicities which are takes place due to the drug, and how to overcome these, and which drugs we should have to administer. Then what are the medication error maybe takes place during the dispensing the drug. Okay. Then our pharmacist must able to interpret the various common laboratory results used in a clinical diagnosis toward optimizing the drug therapy. One better thing is done by our PCI in year 2020. They are given specific pathophysiological condition and common laboratory results for the interpretation. In earlier syllabus, we are not able to judge. There are lots of parameters are there, physiological parameters are there, and students are also students are again get confused which they have to learn, and once they are learned, they are get confused in the various laboratory results. Okay, but now the specific pathological conditions are given, and their laboratory results and their interpretations we have to discuss for the clinical diagnosis towards the optimizing the drug therapy. So dear participants, these are our course objectives. Now we should have to move towards the course outcome. So after achieving these objectives, which outcomes we are expecting from our student? After the successful completion of this course, our students will able to explain about the basic concept of a hospital pharmacy administration. So our hospital pharmacist is able to administer, means they are able to manage the things within the hospital pharmacy. His work as an administrator, he or she should have to work as a trainer within the hospital pharmacy. Then hospital pharmacist is able to manage the supply chain. They must be able to maintain the inventory within the hospital, and they should be properly distribution of drugs within the hospital. This is very complicated process. There are various methods we are used for the distribution of drug within the hospital, because each and every patient should have to get the drug within a proper time, at a right time, we can say. Right medication should have to reach the patient in a right time, in a right dose. Okay. Then our pharmacist should have to work with the healthcare providers, such as the physician, consultants, nurses, with the hands, means they should have to work within the hospital by attaching shoulder to shoulder with the physician, consultant, and other nurses within the hospital. And they should have to able to identify the various incompatibilities in our prescription, and they are able to monitor the drug therapy, drug regimen, and address the patient drug-related problem, such as the adverse drug reaction, drug-drug reaction. And again, our pharmacist is able to report these adverse drug reactions to the Indian Pharmacopoeia Commission or the CDC of Government of India. Okay, there is a particular form is given. I will show you this form. By filling this form, we can report these adverse drug reactions or the drug interactions to the CDC. Okay, then interpret common lab investigation report for optimizing drug therapy. For optimizing drug therapy, yes, either this drug therapy is proper or not. For optimizing this, we should know about the various common lab investigation, and we are able to interpret them. What happened if the RBCs are increased or decreased? That, or the SGPT increase or decrease? Okay. So we are able to interpret. Okay. So these are the course outcomes. Then, dear participants, these are some major changes which are made by our PCI in ER 2020. Everyone is discussed, and you also aware, because last year we was faced the change in syllabus last year, but some my colleagues are there and they may be the newly joined the institute. So for them, I just keep this table here. As per ER 2020, we are having our students should have to solve 6 long questions. Each question carries 5 marks. And accordingly, the student will get 30 marks. Then question number 2, this is for we can't say short question, means these are the short questions, okay, but short descriptive question. These are this is for 3 marks. Each question carries 3 marks, and 10 questions are asked on this based upon this short question. And then 1 sentence answer, fill in the blanks, MCQ based questions are there. These are for 20 marks. Okay, so this is the pattern of examination, annual examination. Okay. Then workload. Yes, there are 75 lectures are allotted for the HCP. That is, we can say it's HCT, Hospital and Clinical Pharmacy theory subject. There are 75 hours are allotted, 3 hours per week. Then, as already our Dr. Bansor sir said, 25 hours are allotted for the practical. Each practical we should have to finish within 1 hour. And we are also having a 25 hours of tutorials. Yes, this is a very nice concept which is included in a syllabus, that is tutorial. We can build the attitude of the student. by conducting the tutorial. And by identifying poor student, weak student, we can build their confidence. And by giving proper focus toward them, we can build their personality as well as we can improve their result. Okay, so we can take a group, then we can also give some assignments, short assignments, then MCQ based test. Okay, so because of that, we are able to identify the poor student, and as well we are able to give some more focus toward these students. So here I make some strategic plan for a lecture. Okay, so this method is generally followed by me. This is not necessary that everyone follow this method, but this method generally I follow while conducting the lecture. So we are having a 75 lectures, total 12 topics. So for a first sessional, I keep a 3 topics, 1, 2, and 3 as per the syllabus. And these 3 topics we can we are having a 24 hours to finish these 3 topics. Okay, as we are having a some time for the first sessional, and students are newly joined the classes, and which lecture, which topic required 6 hours sometimes to finish this chapter, but sometimes it required 8 or 9 lectures. Okay, then we have to increase the speed. So accordingly, I decided to finish first 3 topics here for the first sessional. Okay, then 4 to 8 for a second sessional, and from 9 to 12 for a third sessional. Then this is my plan of session. Okay, so in a 5 to 10 minutes, I recapitulate or introduction for the new topic. Then for second 15 minutes, I start with the topic and discuss the topic. Then in next 10 minutes of 1 hour, okay, discussion and question answer session. So I can able to check, I am able to check the understanding of the student. Okay, as per our ER 2020 or earlier, even earlier, we are followed the Bloom's taxonomy, and from which we have to focus over the remembering, understanding, and application level of the student. Okay, so while teaching, we should have to focus over the remembering, understanding, and application is what we teach. Either these students are able to apply or not. Okay, and accordingly, questions are also asked in the annual examination. Okay, so this descriptive plan is not till now. This is not published by the MSBT Mumbai. Okay, then fourth session again we start the next topic, and in fifth session of the same lecture. Okay, summarization. This is for 5 minutes. Summarization and consolidation of topic, and give some home assignment if possible. And in last 5 minutes, I take attendance of the student. So this is my strategic plan. So first topic, this is the hospital pharmacy. Okay. In this hospital pharmacy, as I was told you earlier, hospital chapter is removed, but the new thing is added here. That is, here the good pharmacy practices was added by the PCI in a ER 2020. The remaining things are same, and one thing is there, that is national and international scenario. As you know that there is a different scenario in a US, there is a different scenario in a Britain. Okay, so European countries, they are having a different scenario. Australia is having a different scenario. These countries are having a different scenario, and we are having a different scenario. So as our pharmacist is moving from product-oriented approach to patient-oriented approach, our scenario means we are able to reach the regulations, international regulations. And we are our pharmacist is able to give the services to the patient, like a international, the pharmacists who are working in a US, then the scenario in our India is also changed. So for that, we should have to compare the scenario, and accordingly, we should have to improve the services in our India also. Then organizational structure, professional responsibilities. This is the common thing, this is the thing already was teach to the student. But what new things are included in our syllabus, that is good pharmacy practices. Yes, this is very important. While working in a industry, we follow the good manufacturing practices, good laboratory practices. Means when I was joined the industry, so first of all, my senior said me that, yes, go through the good manufacturing practices, CGMP, which are given by the USFDA. Then after that, my senior asked me the lots of questions over the GMP. Then and only then they allow me to work in this area, manufacturing area. So like that, our pharmacists should also follow the good pharmacy practices in the hospital pharmacy. So because of that, the response of patient is increased. Professional services we are able to provide to the patient. Professional ethical practices we are able to provide to the patient. So for that, good pharmacy practices are included. The next, hospital pharmacy standards. These hospital pharmacy standards are given by the International Pharmaceutical Federation. Now, this International Pharmaceutical Federation is established in 1992. Then American Society of Health System Pharmacy, they are given some hospital pharmacy standard. Okay. So they are given 9 standards for the hospital pharmacy. So if our students follow these standards, then we are again able to achieve the scenario, international scenario, means the international pharmacists, how the international pharmacists are working or the US pharmacists are working. Then introduction to NAQS. These are the National Quality Assurance Standards, which are given by the Government of India, Ministry of Health and Family Welfare, Government of India in 2020. So our pharmacists should aware about the National Quality Assurance Standard 2020, and as well our pharmacists, the hospital should require a NABH accreditation. This is the National Accreditation Board of Hospital. So this our pharmacists should aware about this accreditation. Then and only then, when the hospital passes from this accreditation, their inspection, then our pharmacist is also plays a very important role. Okay. In this chapter, means the hospital chapter is already hospital topic is removed from the syllabus, but we should have to cover the hospital topic. Okay. Then next topic is a different committees in a hospital. Which are the different committees which are working? There are so many committees which are working within the hospital, but few committees are given in our syllabus. These are the pharmacy and therapeutic committee. This is already in a earlier syllabus. Hospital formulary is also there, but one new committee is added in our syllabus. This is the infection control committee. As we know that our antibiotic resistance takes place. So to prevent this, there is an infection control committee is there. And what are their role? And what is the role of pharmacist in preventing antimicrobial resistance? Okay. So these things we have to discuss. Then supply chain. Dear participants, my respected lecturers, if you have any queries, you can put in a chat box. At the end of the session, I will address these queries. Okay. Already you aware about the syllabus. I just go through it. Okay. But if you have any queries, you can place your queries in a chat box. Okay. So then preparation of drug list. Earlier, if we see, there is some noise outside of our college. So, hope I'm audible to all properly.
Yes,
So
sir. Yes, sir. We are not finding any disturbance.
Okay, madam. Okay. Thank you. So preparation of drug list. As we see, after the completion, even after the completion of course, our students are not able to find the drugs. They are not able to prepare the drug list. What are the H1 drugs? Means they learn the things. But now our syllabus is more practical oriented syllabus. Okay, means here we are more focused toward the practicals as well as the student understanding. Now we are giving a more emphasis over the what are the different how to prepare the list, what are the high risk drug, emergency drug, schedule H1 drug, then narcotic drugs and psychotropic substances, and how to store them, what are the reserve antibiotics, and other general over the counter drugs. Okay, so pharmacist, after the completion of course, our pharmacist is able to prepare the list of drug. Means if our pharmacists like to start the pharmacy, then they are able to immediately prepare the list of drug. They are able to perform the survey. They are able to perform the hospital survey. They are able to perform our pharmacy survey within their area. Procedure of drug purchase. Okay, how to place the tenders. Okay, then means how to generate the requisition. Okay, then how to maintain the inventory. These things is miss elaborately miss we can elaborate to the student. Miss student can able to understand these things very well with this syllabus, and even the 14 hours are given to discuss this supply chain and inventory control. That much time is more sufficient to discuss all these things. In the COVID, in the pandemic situation, most of the means after the discovery of various vaccines, so many countries are facing a problem of cold chain supply of vaccines. But our India is not having any problem because this system is already means we are using this system, cold chain system, and we are already maintaining this system. So that's why we are not facing any kind of problem. Okay, but after the completion of course, our pharmacists should know. Then FEFO, that is the first expired, first out method, means while maintaining the inventory, which system we can adopt. That is the FEFO, FIFO. FIFO means first in, first out method. Okay, first expired, first out, first in, first out methods. These are the methods. So we can adopt any one of the method in our hospital pharmacy. Then expiry drug removal, there is a procedure, there is a protocol, or we can say the standard operating procedure for the removal of expired drug, handling of drug, disposal of narcotics, psychotoxic drugs. Okay. Then documentation. Yes, this is again very important part. If our student is already aware about the documentation part, then they will not face any kind of problem. Means we are developing the entrepreneurs. We are developing the entrepreneurs as already they are aware about the documentation part and how to maintain the inventory, which document they are required. Okay. So then drug distribution. Yes, this is as this chapter we are having in earlier syllabi, and this is as it is taken over here, but some things are added here. That is the distribution on narcotic and psychotropic substances, their storage, and automated drug dispensing system and their devices. These 2 points are added here in the drug distribution, and this chapter is allotted. 7 hours are allotted for this chapter by the PC in the ER 2020. Then compounding in hospital. Nowadays, we just think that we purchase the fixed doses in our pharmacy and we just dispense these fixed doses, combinations to the patient. But we can think to manufacture the bulk compounding. I was attend some international conferences where one resource person said that sometimes if the doses, the recommended doses are not available, they are prepared in their own pharmacy. Okay. So this facility we should have in our pharmacies. So nowadays this facility, I think nowhere is available in our India. But with this year 2022, somewhere this system can be adopted in future. So here we are going to teach bulk compounding, IV admixture services and their incompatibilities and total parental nutrition. This is TPN. Okay. The next, radiopharmaceuticals. This part is previously this is added in a pharmaceutical chemistry 1. But now this is added in a hospital and clinical pharmacy. And here, the storage, dispensing, and disposal of radiopharmaceuticals, this part is included. Okay. So here we should have to learn about the handling of radiopharmaceuticals. So for that, we can give more exposure to the student by field visits. Okay. If we go towards any X-ray technician or the X-ray service provider, CT scan, or the MRI, where there is a MRI performed. So our student will get the better exposure. Okay. And where the radiotherapies are given, okay, if we ask the technician for the guest lecture, then our student may more benefited. Or if we actually present them how to store the radiopharmaceutical and where to store, then they will more benefited. Okay. So for that, there is need to make some MOUs with the some various diagnostic centers. Then application of computer. Yes, this is very necessary nowadays. We are everywhere. We are using the computer, and by using the computer, our workload is decreased too much. Okay, and even we are able to maintain the inventory properly. We are able to maintain inventory. We are able to generate the various requisition, shortage of doses, various doses or the drugs that can be immediately informed by the system. But when our students are passed out from the institute, they are not aware about the various softwares. One better thing which has happened with me while preparing this slides or while preparing this orientation thinking over this orientation program, if we make some MOUs with the some pharmacies such as the Apollo Pharmacy, Medicare Pharmacy, then our students are more aware about the various softwares. And already the Dr. Bansod sir said they are given some link for some software, how to handle the software. So this is again much better. Okay. Then clinical pharmacy. As I was told you that our pharmacists should have to move from the product-oriented approach to healthier patient-oriented approach. So for that, our pharmacist, so that is maximizes the well-being of the patient while on a drug therapy. So for that, our pharmacist should aware about the various clinical terminologies, then various how to take a ward rounds with the physician consultants, then various common medical terminologies. Okay, so common medical terminologies means what I think. मुझे क्या लगता है कि कॉमन मेडिकल टर्मिनोलॉजी जो है ना, एक बार हम ऐसे पढ़ा देते हैं. दिस इज द 8th chapter. It takes so many days. Means after passing so many days, we start the common medical terminologies. So this is much better. We give a 5 terminologies every day to the student or whenever we are having a lecture on this class. So because of that, our student go through these common terminologies, and whenever these terminologies came in their syllabus, or in other chapters or in our hospital pharmacy, they are aware about these terminologies. Okay, that can we do, and I follow this this procedure. Okay, this practice. Okay, then treatment chart review. Treatment chart review are placed in a wards, hospital wards. So pharmacist is able to review this chart. Okay, so we can take a photographs of this chart and we can show our student, or we can give some activities to the student that go in some hospitals where we are having a wherever we are having a MOUs with the hospital. Then this student means we should have to send our student and tell them to review the charts. Okay, so then our students are able to identify or monitor the adverse drug reactions. So we, this chapter means we are having a separate chapter in earlier syllabus, but now this is included in this clinical pharmacy chapter. So here we have to discuss this adverse drug reaction and their classification, and how the what is the mechanism of adverse drug reaction and how the adverse drug reaction can be takes place. Drug information and poisonous information. This here we have to cover the drug information center, whatever the things which was discussed in a drug information center in earlier syllabus. Okay, and information about the various poisons. Medication history, this information related with the poison information, this is given into the National Formulary of India. Okay, in a brief, National Formulary of India. Now I think there is a 2020 or 21 edition is also available. Okay, then medication history. So how to maintain the medication history and what is the important principle behind maintaining the medication history that we have to teach to our student. So other things such as the pharmaceutical care, this is the new point which is included in our syllabus. Classification of drug related problems, principles and procedure to provide a pharmaceutical care. Okay, means if any adverse drug reaction is occurs, so how we can overcome this adverse drug reaction. Okay, so this is come under the pharmaceutical care. Then medication therapy management and home medication review. This point is also included, and we should have to give more emphasis on these points also in a clinical pharmacy. The next, physiological parameters with their significances. So here mainly the hematological, liver function test, renal function test, thyroid function test, test associated with the cardiac disorders, fluid and electrolyte balance, and pulmonary function test. These are given. Okay, so mainly we are focused on these particular physiological parameters. So our student can better understand and interpret the various physiological parameters. Means what happened if the SGPT or AGOT is get changed, or bilirubin is get changed than the normal. Okay, then they can be easily identified. Okay, then poisoning. Sometimes poisoning can be takes place due to the drug, due to the various poisons. Okay, sometimes due to the cholinergic drugs. Okay, if the drug are given in a large doses. So for that, the classification of poison is already given, and this is also given into the earlier syllabus. But now the antidotes are also given. But now here, the drugs and poison information center and their services. This part is included. Okay, definition, requirement and information resources with example and their advantages and disadvantages for the drug and poison information center. This is included in the syllabus, and this is again given into the National Formulary of India in brief. Then pharmacovigilance. Yes, pharmacovigilance is very necessary wherever the various adverse drug reactions are occurred, and so we should have to study. We have to this vigilance should be there on the drugs. So for that, the pharmacovigilance, this chapter is added, and now this field is in a boom. Okay, so that's why again the 2 hours are given for the pharmacovigilance, and this is much beneficial for our student also. Then medication error. So while administering the drugs, there is a chances for the medication error. So to overcome this medication error or the drug-drug interaction, we should have to teach our student what kind of interaction can be takes place, and how they can be overcome if we are already if this interaction is already known to our pharmacist, then that can be rectified, that can be overcome, or that can be prevent to be happen. Okay, then some here the LASA drugs are added. Okay, this is the look alike and look alike. Okay, the look alike and sound alike, that type of drugs. Okay, so sometimes the very mishaps can be happen due to the look alike and sound alike drugs or their brand names. Okay, there are 6 hours are allocated for this chapter. Okay, so dear participant and my respected lecturers, these are the chapters are included in ER 2020. These are the various assignments. There are I think 10 assignments are given, and this is suggested that we should have to give the different assignments to the different student, and we should have to cover all the 10 assignments. Okay, so there is format is also given for the assessment of assignments. Okay, so by following this criteria or the rubrics, we should have to assess the student. Okay, the next field visits, we should have to give the field visits. We should have to go for the field visits in the government hospital or the private healthcare hospital or facilities. As well, we can make MOUs with some diagnostic centers or pathologies or the pathologies. Okay, for the better understanding of various physiological parameters and how the pharmacies are running in a hospital, within the hospital. There is a hospital pharmacy. Okay, so this is about the field visit. Then these are the recommended books. These 5 books are recommended by the PCI, and some 2 books are included by me that you can also refer. Okay, National Formulary of India 2021 and Hospital and Clinical Pharmacy by Nirali Prakashan. Okay, so dear participants, if you have any queries, you can ask the question or you can place your question in chat box. Thank you for your patience listening.
Thank you, sir. Yes, dear participants, if you have any questions, query with respect to this subject, please paste your questions in the chat box.
Yes, dear participants, if you have any queries, you can ask the questions. Yes.
I think so, sir. There are no queries because you have very well explained each and every point in detail with respect to which textbooks we can refer, assignment point, field visit, as well as each and every information or each and every chapter, how we can take the in detail. So,
okay, thank you, madam.
Yeah. So, one question we have received that how much this field visits are expected.
Okay. This is not given in a syllabus. How much field visits we have to go for the field? How many visits we should have to give to the hospital? But what I think, whenever as per our syllabus, we should have to make a MOUs with some hospital. And if we go for 3 to 4 times in a hospital, this is much better. Okay. When we go in a hospital once, then students are not able to understand anything. Okay. जैसे मैं सोचता हूँ कि जब हॉस्पिटल में हम जाते हैं, जैसे कि हम इंडस्ट्री में लेके जाते हैं स्टूडेंट को, क्या होता है कि स्टूडेंट बस देख लेता है, उसे कुछ समझ में नहीं आता, देख लेता है बस, उसे थोड़ा सा स्ट्रक्चर, उसका ऑर्गेनाइजेशन समझ में आ जाता है, but they are not able to understand each and everything. So government hospitals are allow our students and our students are able to see the medical record. Then they are able to see the various whatever the day-to-day treatment is given to the patient, and how to administer the doses by the nurses, and how the drug are dispensed to the patient. What I do, I make a MOU with our government hospital, civil hospital, and we generally recommend our student go for a 2 to 3 hours in the evening or on a Sunday to give the service to serve the patient. And some student, our students are also working in this hospital, so that's why they are guiding to our students. So this is not necessary how many visits, but if our student visited to the hospital pharmacy, then to the pathologies diagnostic center, then our diagnostic center where the radiopharmaceuticals are used, or the radiopharmaceuticals are used for the treatment, then this is much beneficial for our student. Okay. Yes, any more questions?
Yes, sir. That is one of the important things that you have mentioned, that we can sign MOU with different hospitals. So this will be definitely helpful for all the students.
Yeah. Yes, madam.
Sir, there is one question with respect to how to evaluate field visit marks.
How to
evaluate field visit marks?
Yes. There is a format is given. Sir, there is a format is given for the field visit, and there are rubrics are also given. Rubrics are also given for the assessment of field visit. Okay. See. Yes, objectives set for the field visit. Okay. So student have to write 2 to 4 objectives. Then prior preparation of the student for the field visit. This is in a minimum 100 words. Describe the general experience during the field visit. Okay. This is in a minimum 100 words. Learning points. Describe what theoretical concept that is correlated during the field visit. This is in a 300 words. Okay. So we should have to, there is not a proper criteria is given for the assessment, but we can assess based on the criteria which is given for the assessment of assignments. Okay. Assessment of assignment. These rubrics we can use for the field visit. Okay.
Yes, sir. Thank you, sir. There is one more
Yes,
one more question with respect to textbooks. I think so. Will you please share this slide with respect to textbooks, so that other.
Yes, you can take a screenshot. Okay.
Yes, sir.
Sharing right now. Yes, my screen is visible now, madam.
Yes, sir. Yes.
Madam, I place the photo of this page. Okay, sorry.
Yes.
Moving now. Yes, yes. Yes, you can take a screenshot. Okay.
Yes, sir. Thank you.
Any more questions, madam? Any more questions are there?
No, sir. There are no more questions.
Yes.
So,
thank you, madam.
Yes, sir.
And
so,
thank
sir,
you everyone for your patience listening.
Yes, sir.
And I also thank to Dr. Somani sir as well as Bhugesh sir for giving me the opportunity to talk with our respected lecturers and the principals. And
Yes,
thank
sir.
you, Anjali madam.
Thank
Thank
you.
you.
Thank you, sir. Because the presentation was very much informative, and definitely all participants, they must have got very good information, because you have explained each and everything in detail. So that is one of the informative session we have received from you, sir. Thank you very much from DY Patil, Institute of Pharmacy.
Thank you, ma'am. And thank
Thank
you
you.
everyone for your nice comments. Thank you. Thank you.
Thank you, sir. Thank you, sir.
Really, I appreciate it. Thank you.
Thank you, sir. So dear participants, so we will have break. So 1:30 to 2:30 we are having break. So sharp at 2:30 we will meet for the next session, that is orientation on subject pharmacy law and ethics. So now all of you can remain in the meeting, but we can start this session sharp at 2:30. Thank you everyone. Good afternoon, everyone. Good afternoon, ma'am. Welcome, ma'am, in this session. Ma'am, please, can you unmute yourself? Hello.
Yes. Anjali madam, are you able to hear me?
Yes, ma'am. Yeah.
Okay, please
Yeah.
proceed.
Yeah, so good afternoon, everyone. So the next and one of the important last session we have today is orientation on subject pharmacy law and ethics. And today we have with us Dr. Smita Naik. So before we start with this session, I would like to introduce Dr. Smita Naik. Ma'am, she is working as professor and HOD Department of Pharmaceutics in Gallup Institute of Pharmacy, Koper, Khairane. She has completed her B.Pharm and M.Pharm in pharmaceutics from Bombay College of Pharmacy and PhD from CU Shah College of Pharmacy at SNDT University. She has guided very n number of M.Pharm students. She has industrial experience of 8 years and has worked in FDC Limited and Piramal Healthcare Limited in departments of quality assurance and formulation development. She has launched several commercially successful products in the domestic as well as international markets. She has taught pharmaceutics, dispensing pharmacy, novel drug system, and jurisprudence to B.Pharm students and guided more than 15 M.Pharm students. She has secured grants from various several bodies as well as has conducted numerous seminars in college and has presented posters at national as well as international conferences. She has more than 60 publications to her credit. And as the HOD of the diploma course at the institute, she has written a textbook for the subject pharmacy law and ethics, which is an excellent summary of the regulatory guidelines and that every student should be aware of. So, ma'am, today I am welcoming in this session. So, we all are eager to hear all the informative session with respect to this subject. Ma'am, I'm hand over this session to you.
Thank you, Anjali madam. Good afternoon and a very warm welcome to the participant faculty members of diploma colleges across India. I can see, in fact, 175 participants right now, in spite of this being the last session of FDP. So I'm sure that I should keep the tone very interesting. Okay, I'm Dr. Smita Naik, HOD, Gallup Institute of Pharmacy, Navi Mumbai, and I'm pleased to be on the panel of distinguished experts for the final year diploma syllabus that has been framed in accordance with ER 2020. My congratulations and thanks to Dr. Rakesh Somani, Principal, D.Y. Patil School of Pharmacy, Mr. Aditya Ghuge, Ms. Anjali Takke, and the team for putting up this excellent program at such short notice. I extend my thanks to Mrs. Manjiri Gharat, Chairperson, IPA Community Pharmacy Division, for encouraging me to give this talk today. I am also thankful to the management and principal of Gallup Institute of Pharmacy for extending their support. As seen over the last 2 days, that is yesterday and today, the course objectives, course outcomes, and general pattern of examination has already been explained very well by Dr. Kale, Dr. Dias, Mr. Raj Vaidya, Dr. Argade, Mr. Marathe, Dr. Rajan today morning, Dr. Bansod, and Mr. Ade. So in my presentation, I will not touch upon the general pattern of the examination. Rather, I will go directly to the syllabus of pharmacy, law and ethics. What topics are to be taught, to what extent they are to be taught. So today's presentation is basically my interpretation of how and how much the students should be aware of the laws and ethics, patents, etc. I'm sure that as the year progresses and as we teach this subject, it will evolve and we will come up with newer ideas and additions to what I present today. This subject of pharmacy, law and ethics is the only subject that is non-practical but is most useful in practical life. So let us look at what the subject offers the students and how we as teachers can make it more appealing to them. I hope that the audience is able to hear and my speed of speaking is appropriate.
Yes, ma'am. Ma'am, you are audible as well as the speed is also
okay. Thank you so much. Now I will move on to my presentation. So just hold on for a minute till I share the screen. Yes, I think my screen is now visible to everybody.
Yes, ma'am.
Okay. So my screen is once again welcoming all the faculty to this online faculty development program on orientation of the SYD pharmacy syllabus as per ER 2020. This is the subject that we are going to discuss right now, pharmacy, law and ethics. Now coming to the question of whether this is a new subject. Let us start with understanding whether this subject is new. The answer to this is yes and no. Let me explain to you in my next slide what exactly I mean by this. Here, you can see that as per ER 1991, the final year had the subject of pharmaceutical jurisprudence, under which 8 acts were covered. Okay. Now, as per ER 2020, there is a subject pharmacy, law and ethics, where these 8 acts plus few new acts, so totally 13 acts have been covered, plus certain new concepts have been introduced for the first time. So where ER 1991 prescribed 50 hours syllabus for pharmaceutical jurisprudence, now under pharmacy, law and ethics, 75 teaching hours have been assigned to the subject. And certain new topics such as FSSAI, that is Food Safety and Standards Authority of India Act and Rules, Code of Pharmaceutical Ethics, Role of Government Regulatory Bodies, Good Regulatory Practices, the BCS System of Classification, Bioethics, Medical Devices, and patents, to name a few additional points that have been included under this subject. So in all, we are having 21 chapters under this subject, the maximum number of chapters that is assigned to any of the subjects. Okay, I will just read out briefly what are the course objectives. Now this course, that is pharmacy, law and ethics, is designed in such a manner that the students will gain an understanding of the general perspectives, that is why laws are necessary, history, that is how the laws have evolved over a period of time, and the details of evolution and current laws in India. The student should also know acts and rules that regulate the profession and practice of pharmacy in India. Another important thing is an understanding of ethical guidelines. It has become very, very important to impart to the students the need for ethical behavior and the necessity to understand and follow ethical guidelines pertaining to standards that are applicable in the industry. Also, a bonus to the students is brief introduction to the patent laws and their applications in pharmacy. So these are the aspects of pharmacy, law and ethics that we are supposed to impart to the students. Okay. Coming to chapter 1, which deals with general principles of law, history, and introduction to other acts. As you can see, the timeline that is assigned to this chapter is only 2 hours, for which purpose it is necessary to give an overview of the history and various acts related to the drug and profession in a period of 1 to 2 hours. Now, the first topic, that is general principles of laws, is where you explain to the students the need for having laws. Why are laws necessary? Why is it necessary that the pharmacy profession has to be regulated? That falls under the general principles of law. Coming to the history of the pharmacy, we can start with the treatment modalities in ancient times, right from Ayurveda to Siddha, Unani, and later on homeopathy. These systems of medicine can be explained in brief. From there, the next move is to the early 1900s, where we had these individual pharmacies, like the first chemist shop in India started by Mr. Bathgate, right up to the different companies that were established across India. We can also talk of the fact that the medicines that were manufactured locally were very less as compared to the demand. This led to import of medicines which were not of standard quality, leading to several adverse events. And this forced the government to establish the Chopra Committee, or the Drug Inquiry Committee, whose function was to look into the quality aspects of the drugs that were being imported into India. Now, the Chopra Committee is available on the internet, and you can download it and go through it. It is a vast document running into probably 40 to 50 pages. And the exhaustive and excellent amount of work that has been done by Chopra Committee has been documented. However, a gist of the activities carried out by the Chopra Committee and their recommendations can be found in any standard textbook that is available in the market. Okay, so you can explain on the basis of any standard textbook the Chopra Committee, the activities carried out, the objectives carried out, and the recommendations given by the Chopra Committee. This further led to passing of the Drugs Act 1940 and subsequently the Drugs and Cosmetics Rules 1945. So this is the history of pharmacy and pharmacy laws, starting from the ancient systems of medicine to the Drugs and Cosmetics Rule that was passed in 1945 and has been amended subsequently. The third aspect of this chapter deals with various acts that are related to the profession. So under this, in brief, several relevant acts can be explained to the students without going into details. This is because we are going to explain most of these acts again in the further chapters. So in this chapter, the students only need to know the name of the act and what that act pertains to. So I have put down a list of about 14 acts in this chapter, which can be explained in brief to the students here. So this is as far as chapter 1 is concerned, general principles of law, history, and acts related to drugs and the pharmacy profession. Coming to chapter 2, which deals extensively with Pharmacy Act 1940 and rules, and the time assigned to it is 5 hours. So we can start with explaining the objectives of Pharmacy Act 1948 and go forward to the important definitions given under this act, that is Central Council, Central Register, Executive Committee, Indian University, Medical Practitioner, Registered Pharmacist, the most important definition, State Council. Next, moving forward, we then have to explain about Pharmacy Council of India, which was constituted under the Pharmacy Act. So the important points here that need to be explained are the constitution of the Pharmacy Council of India, that is who are its members, and how they are elected, and whether they are eligible for re-election. All these aspects have to be explained under the constitution of PCI, followed by the functions of PCI. Now, the major functions of PCI are classified into education regulations, setting of education regulations, approval of institutions that impart pharmacy education, maintenance of central register, and other miscellaneous duties, which can be found on their website, or you can take it from any standard textbook. Further, each state has its state pharmacy council, or 2 or more states have their joint state pharmacy councils. So under state pharmacy council and the joint state pharmacy council, the constitution of each and the functions that are performed by these councils can be explained. One important question that is generally seen in the question papers is differentiate between state and joint state pharmacy council. So that is one topic that can be taught, differentiation between state and joint state pharmacy councils. Next, we come to registration procedure of pharmacists. Now, we are all aware that the registration of pharmacists is done online, but students need to know about the first register, how it was prepared, when it was prepared, what are the contents of the first register, and how to renew registration. These are important points that have to be discussed under the registration topic. And finally, offenses and penalties under the Pharmacy Act are to be explained here. So this is for a total period of 5 hours. Further, the PCI has laid down the Pharmacy Practice Regulations 2015. So this is a relatively new concept that has to be explained to the students, and they have to understand that if they are going into pharmacy practice, they have to comply with these regulations. So this Pharmacy Practice Regulations 2015 has given all information under a total of 9 different chapters. Chapter 1 gives all the definitions related to these regulations, which have to be learnt by the students. Chapter 2 discusses the privileges of registered pharmacists. Chapter 3 discusses the duties of registered pharmacists towards their patients. Chapter 4 discusses duties and responsibilities of registered pharmacists. So under these chapters, we have to discuss the topic given in brief, such that the students are able to write relevant answers. So from the point of view of complying with the regulations if they go into pharmacy practice, and from the examination point of view, it is important that the focus should be the subject, the topic that is given in each chapter. So definitions under chapter 1, privileges of registered pharmacists should be taught under chapter 2. So you can teach chapter wise. Under chapter 3, duties towards patients, and under chapter 4, duties and responsibilities towards each other, that is towards registered pharmacists, needs to be explained. Chapter 5 discusses the responsibilities of the registered pharmacists to each other as fellow colleagues. Chapter 6 discusses the duties of registered pharmacists towards the public and to the profession. Now, these pharmacy regulations, practice regulations 2015 are available on the net and can be downloaded by you and forwarded to the students. Chapter 7 discusses unethical acts that a pharmacist should abstain from, that is, pharmacist should not do. Okay. Chapter 8 gives a list of activities that are considered as professional misconduct and which the pharmacist should stay away from. In chapter 9 is given punishment and disciplinary act in case of professional misconduct. Finally, after the 9th chapter, there are 3 appendices given. Appendix 1 is a declaration or a pledge by the pharmacist. Appendix 2 gives a format for maintaining the records of prescriptions received by the pharmacist. And Appendix 3 discusses the duties and responsibilities of different cadres of pharmacists, like senior pharmacist, junior pharmacist, trainee pharmacist. What are their duties? What are their responsibilities is discussed under Appendix 3. So far, we have discussed the first 2 chapters out of 21 chapters that are a part of the syllabus of pharmacy, law, and ethics. The first chapter was a brief overview and introduction. Chapter 2 dealt with the Pharmacy Act and the PCI. Chapter 3, which is the heart of the whole subject and has been assigned almost 1/3 of the hours, 75 hours, is the Drugs and Cosmetics Act and rules and new amendments. So under this chapter, everything that is there to know about the Drugs and Cosmetics Act's rules and regulations pertaining to them has been discussed and should be thoroughly passed on to the students. Although the syllabus gives various points, I have here, when I'm discussing this chapter, I have put down the points chapter-wise. So there are 5 chapters here as given on the slide. Chapter 1 deals with the important definitions under DNC Act and rules. Chapter 2 deals with Drugs Technical Advisory Board or DTAB, Drugs Consultative Committee, DCC, and CDL or Central Drugs Laboratory. Chapter 3 discusses rules and regulations pertaining to import of drugs and cosmetics. Chapter 4 discusses the manufacture, sale, and distribution of drugs and cosmetics and various rules, regulations, forms, and licenses for these. Chapter 4A discusses provisions related to Ayurvedic, Siddha, and Unani drugs, while Chapter 5 deals with several miscellaneous topics. So coming to Chapter 1, which deals with definitions, we can start with reading the objectives of the Drugs and Cosmetics Act and explaining them to the students, and moving further to very, very important definitions of the entire subject. That is drug, cosmetic, Ayurvedic, Siddha or Unani drug, definition of manufacture, definition of patent or proprietary medicine. Chapter 2 deals with the administrative part. Now, these Drugs and Cosmetics Act and rules have been laid down, but who is going to look into them? Who is going to advise the government and who is going to act on it? So there are 3 bodies which are responsible for administration of these act and rules. The first is the Drugs Technical Advisory Board, DTAB. Then we have the Drugs Consultative Committee. And finally, analysis being carried out at the Central Drug Laboratory. So all these 3 bodies have to be discussed with respect to their constitution and the functions that they perform. So what has to be explained to the students under Chapter 2 is the constitution and function of DTAB, DCC, and CDL. Chapter 3, which deals with rules and regulations for import of drugs and cosmetics. Here again, there are important definitions which should be known to the students. Misbranded drugs, adulterated drugs, spurious drugs, misbranded cosmetics, adulterated cosmetics, and spurious cosmetics. So these definitions are included under Chapter 3 and need to be discussed with the students. Also, this chapter elaborates on the procedure to import drugs and cosmetics. So where any manufacturer or any seller wishes to import drugs and cosmetics, he or she should first have a registration certificate and an import license. So it is necessary for the students to understand that there's a two-step procedure for import of drugs and cosmetics, starting with procurement of registration certificate and then applying for and procuring import license. So all the relevant forms, for whether it is for application or whether it is the form in which license is obtained, has to be discussed with the students. The students should know in which form the application should be made and in which form the license is obtained. Next comes the rules pertaining to prohibition of import of certain drugs or cosmetics. It is necessary to understand that not all drugs or cosmetics can be imported. There are certain classes or categories of drugs and cosmetics which cannot be imported, which should not be imported. So this should be known to the students. And in case of import of such drugs or cosmetics which are not permitted, then what is this offense and what is the penalty for such an offense is what is to be next explained to the students. Chapter 4 again further deals with manufacture, sale, and distribution of drugs and cosmetics. Now, this is a chapter that tells you about the forms in which to apply for manufacture, sale, and distribution of cosmetics. It tells the form numbers for application. It tells the form numbers in which the licenses are obtained. Therefore, rather than discussing in detail about each of these forms, what I have done here is I have listed all the form numbers, most of the form numbers, right from form number 19 to form number 46, deals with manufacture, sale, and distribution of drugs and cosmetics. So if you go to the Drugs and Cosmetics Act and you look up these different form numbers, you will find the terms and conditions that are prescribed by the regulatory agency for applying for license or for procuring the license. Okay, so under the topic of manufacture, sale, and distribution, we have to discuss different forms for applying for either manufacture or sale or distribution. The students should know the form numbers in which the licenses are obtained. They should know the validity of the license. They should know the terms and conditions which have to be complied with for getting that license. Okay. So the terms, so what has to be known is not only the form numbers, but also the conditions for grant of these licenses. What is also important is to know if sale and manufacture of any drugs or cosmetics is prohibited. So then the student knows that such a drug or cosmetic should not be manufactured or should not be sold. So under chapter 4, forms, different forms for application, forms in which licenses are obtained, conditions under which the license will be granted, and prohibitions, if any, should be discussed and explained well to the students. Also important under chapter 4 of the DNC Act is to discuss the various regulatory authorities. There is licensing authority, which is responsible for issuing the license. There is a controlling authority who's going to exert control over various activities. There is government analyst at Central Drug Laboratories who is going to analyze the samples that are given to him. And there is a drug inspector whose duties involve inspection of samples, random samples at pharmacy stores as well as manufacturing firms at storage places, etc. So government analyst and drug inspector, there's quite a lot of information available on both these, and detailed information regarding their duties, responsibilities, and the procedures followed by the government analyst and drug inspector should be conveyed to the students. Finally, The syllabus prescribes a limited number of schedules to be explained to the students. So whether it is C, C1, G, H, H1, K, P, M, schedule M, that is GMP, N, X, and Y, clinical trials, all these schedules should be explained to the students. Now, these schedules are available in the DNC Act and you can refer them. They are very simple and easy to understand. And I'm sure several of you are already experienced teachers. So I am not going to explain to you what these schedules are. But what I suggest to you is you can read them, you can understand them, you can summarize them, and you can give them to the students. Okay. Now, in the last 2 years, because of COVID, whatever lectures I have taken, especially with respect to jurisprudence for the BPharm students, I have uploaded them on my YouTube channel. So the entire DNC Act 1940 and Rules 1945 is present in 12 different installments on my YouTube channel. The address for which is, the link is Dr. Smita Nayak _Pharm Edu videos. So you can take a screenshot of this and you can save it and you can go through yourself if you want, if there are any doubts with respect to DNC Act. Another suggestion which I have is when you explain these schedules and you try to tell the students, for example, the font of the generic name should be larger than the branded name. What I do is I explain with the help of actual samples or with the help of these images. As you can see here, the brand name and the generic name, right? In order to explain to the students how the label claim is to be put as per the schedule, I have put here a real life example. So I've taken the photograph of a marketed product and I've explained to them how the content is supposed to be written. When it is an ointment for external use, it has to be written in this manner. Instructions for handling of the package should be written in this manner. It is important and mandatory to mention the manufacturing location on each and every product. So what I have done is I've taken the packs and I've explained to the students the different schedules. This makes it easy to understand and for them to retain the information. So that was chapter 3. As I told you, it is the bulk of the syllabus of pharmacy law and ethics and deals with the Drugs and Cosmetics Act and rules. We now move to chapter 4, which is for a period of 2 hours and deals with Medicinal and Toilet Preparations Act 1955. Under this chapter, there are the objectives of this chapter are defined, followed by a large number of definitions, all of which are important. So this is the list of the definitions given under chapter 4 and which should be explained to the students and they should know if there's a question in the paper how to write this. So beginning with alcohol, coca derivative, coca leaf, derivative of opium, dutiable goods, excise officer, manufacture, narcotic drug, toilet preparations, spirit store, substandard preparation. There are 19 different definitions given under this chapter, all of which should be studied. This is followed by the procedure for obtaining license under the Medicinal and Toilet Preparations Act 1955 and the offenses and penalties that will be incurred if the rules and regulations are not complied with. The next chapter is on Narcotic Drugs and Psychotropic Substances Act 1985 and rules. And the time assigned for this is 2 hours. Again, we start with explaining the objectives or the significance of this act and rules, followed by the definitions. There are 14 definitions given under this chapter, all of which should be known to the students. These rules and regulations are enforced by authorities and the officers who are appointed under this act. The two important authorities under this act are the Narcotics Commissioner and the officers who report to him, and the Narcotic Drugs and Psychotropic Substances Consultative Committee, who gives advice to the government on matters pertaining to the act and rules. Then comes the prohibition, control, and regulation. Because these are drugs that are not freely permitted to be manufactured or sold, certain amount of prohibition is exhibited, and the powers of the central and the state government in relation to prohibition, control, and regulation by the government agencies should be discussed. Finally, offenses and penalties under this act and rules need to be explained to the students. Coming to chapter 6, again for 2 hours. And the topic is Drugs and Magic Remedies Act 1954. We begin with explaining the significance or objectives of this act to the students, followed by the definitions that are given under this act: advertisement, drug, magic remedy, and registered medical practitioner. As we go along, you will find that many of the definitions are overlapping. Several of the acts will contain the same definitions. So we have already seen the registered medical practitioner under the DNC Act. It has been repeated here. Under this act, the prohibition of advertisements, offenses, and penalties. That is, which advertisements are not permitted on media, which offense, and if they are, then what are the offenses and penalties? This should be explained to the students. But there are some government approved ads and information which are exempt from the provisions of this act. This is very important and should be explained to the students. That is, advertisements that are not covered under the DNC Act because they are permitted by the government and by this act. Chapter 7, a new topic totally which we haven't come across in jurisprudence, that is Prevention of Cruelty to Animals Act 1960, a very short act and to be dealt with in 2 hours time. Explain the significance or objectives of this act, go forward to the definitions given under the act, which includes animal, board, captive animal, domestic animal, IAEC or Institutional Animal Ethics Committee, what constitutes cruelty to animals. Then the two most important committees under this act, that is the Committee for Purpose of Control and Supervision of Experimentation on Animals, that is CPCSCA, and the Institutional Animal Ethics Committee, IAEC, should be covered in greater detail. So explain the constitution, function, and duties and powers of the CPCSCA, and under IAEC, the constitution and what procedure is to be followed to get approval for animal studies from the IAEC has to be explained. So if you can download this act from the net and you can explain to the students. This act also describes how breeding and stocking of animals is to be done, how experiments are to be performed such that no rules and regulations are contravened, how to transfer and acquisition of animals for experimentation, what records are to be maintained by the IAEC and by the Animal House. Under this act, the powers to suspend or revoke registration of any institution also should be discussed. And finally, offenses and penalties that are levied if there is anything in contravention of this act have to be discussed. We move forward to chapter 8, which is Poisons Act 1919. This is a very brief act in which the objective is given. What happens in case of possession, who can possess the poisons, and the rules regarding possession for sales and regulations regarding sale of any poison is discussed. Also further discussed is the procedure for import of poisons and penalty in case of contravention of any of the provisions, and certain exemptions or exceptions have been discussed. So Poisons Act is very brief and these are the only points discussed under the Poisons Act. you can download this act from the net and discuss these points with the students. The next chapter deals with Food Safety and Standards Authority of India, FSSAI, a very important regulatory body that deals with safety of foods. So under this chapter, we will discuss the significance or objective of FSSAI. We will understand, learn, and interpret the definitions of food additive, adulterant, contaminant. And finally, look at the student should know about the authority, that is the Food Safety and Standards Authority of India, FSSAI. The duties and functions of FSSAI have to be explained to the students. Further, food safety aspects related to manufacture, storage, and sale of foods is given in this act and has to be explained to the students. Finally, the labeling of food supplements is discussed in this act, and the same has to be further discussed with the students. Coming to an important chapter, Chapter 10, National Pharmaceutical Pricing Authority and DPCO. This chapter has been allotted 5 hours. So the first topic, independent topic, is that of National Pharmaceutical Pricing Authority. So what is this NPPA? What are the functions and duties that it performs has to be explained to the students. Next is the DPCO 2013, which again can be downloaded from the net. The first part of DPCO consists of definitions. There are 12 definitions given under this act. So all 12 have to be explained to the students. Then the pricing of the drugs has been categorized into 4 categories: sale price of bulk drugs, retail price of formulations, that is non-scheduled formulations, retail price and ceiling price of scheduled formulations, and finally maximum retail price. So under the pricing calculations, there are 4 different categories of prices that the pharmacist should know. One related to sale price of bulk drugs, then comes retail price of non-scheduled formulations, then comes retail price and ceiling price of scheduled formulations, followed by maximum retail price. All these 4 should be explained, and the calculations, I've just written down the formula here for your reference, but it is readily available in any standard textbook. So all these should be explained to the students. Is my voice clear? There is a message in the chat box that my voice is not clear.
Yes, ma'am, your voice is clear.
Okay. And I do have a habit of speaking very loudly. So I hope the participants haven't fallen asleep.
Yes.
Finally, list of appendices to DPCO should be known to the students. They should go through the appendix to the DPCO and try to understand what category, what drug falls into. Just a second. Yes. So there is a national list of essential medicines. The government publishes from time to time the NLEM, or the National List of Essential Medicines, whose price is controlled. What is the objective of this list? What drugs are to be included in this list? And the list of medicines currently that are included in this list should be elaborated to the students. Okay, so NLEM is another important topic under this chapter of NPPA, DPCO, and NLEM. Coming to chapter 11, that is the Code of Pharmaceutical Ethics. Now, ethics is a very important topic that a student should be aware of. We as pharma professionals should follow a particular code of ethics. So for the very first time, the PCI has included the Code of Pharmaceutical Ethics under this subject. So while there is the Code of Ethics, which is framed by the PCI, which we will look at, we should start with a general introduction to what is ethics, what is the significance, what are the different general ethical principles, how ethical problems can be solved, and finally, the code of ethics that is framed by the PCI. So PCI has framed rules and regulations as well as ethics concerning the pharmacist in his day-to-day job, pharmacist in relation to his trade, pharmacist in relation to the medical profession, that is in dealings with the doctors, and pharmacist in his own profession. So this code and guidelines have been very well framed by the PCI and can be downloaded from the PCI website. Finally, we move forward to the pharmacist oath, which is also an important topic that the pharmacist should be aware of, the pharmacist oath. So a brief introduction to ethics. What is ethics? What are the principles of ethics? How to solve problems in an ethical manner? What is the code of ethics? And finally, the pharmacist oath are important topics under chapter 11. Chapter 12 deals with Medical Termination of Pregnancy Act and Rules. This topic is to be explained to the students in a period of 2 hours. So we begin with an introduction where we explain what exactly is termination of pregnancy, medical termination of pregnancy. Then we can move forward to explaining this act, that is the MTP 1971, the aim of the act, and what are the provisions given under this act, and how this act can be carried out. Who can carry out the procedure and where is explained under the Medical Termination of Pregnancy Rules 1975. Okay, so both the act and the rules can be downloaded from the net. Moving forward to chapter number 13, where it is necessary that the students understand about the regulatory bodies that govern the different rules and regulations. The highest body in the country, that is the CDSCO, has to be explained. Introduction to CDSCO and its functions have to be given to the students, and all information can be obtained from their official website. And the second body that has been discussed in the syllabus is the Indian Pharmacopoeial Commission, whose duties include revising and laying down standards in the pharmacopoeia. Again, the IPC can be, information about the IPC can be downloaded from the net, and its objectives and responsibilities should be explained to the students. Chapter 14 deals with good regulatory practices. Now, in the last 2 days, we have come across the regulatory practices in relation to other subjects as well. So even here, when I made this chapter, notes for this chapter, I have referred the Good Pharmacy Practice Training Manual that has been published by the IPA. So I was lucky enough to get a copy for myself, and I have extensively used this reference for writing this chapter on good regulatory practices. Chapter number 14, time allotted 3 hours. Now, we first start with discussing the good pharmacy practice guidelines as laid down under IPA. Going forward to the documentation that is necessary to be done on a day-to-day basis by the pharmacist in a pharmacy store. The pharmacist should know what is a prescription, how a prescription looks like, what are the contents of the prescription, and how he should read this prescription and follow it. So understanding and interpreting the prescription, which is a document, important document, is the first part that should be discussed under this chapter, followed by record keeping. Now, no pharmacy shop will be a good shop if it does not keep appropriate records. And why is record keeping important? Because there are periodic regular inspections, evaluations, visits, compliances. Therefore, a pharmacist should be aware of the different types of records that he or she should keep. This includes the prescription register, in which the details of prescriptions are maintained, the cash memos that are generated when medicines are sold, the purchase bills and register of records, in which he records from where he has procured his supply of drugs, Display of the license to sell in the premise. It is very important to display prominently the license to sell medicines. And it is equally important to display the registration certificate of the pharmacist who is working in the shop. So the student should be aware of the records and documents that he or she needs to keep. So prescription, understanding and interpreting prescription is one. Second is record keeping. All records, including the display of licenses and registration certificate, should be explained to the students. Different licenses and their validity and the renewals should be known to the students. Now, this part is a repeat of what we have already learned under Chapter 3 in the Drugs and Cosmetics Act and Rules. We have already looked at licenses, application forms, licenses, and renewals. So they can be briefly discussed here in the form of a table. Then comes e-governance. The next aspect is e-governance, that is the use of digitization. And these advantages of e-governance can be explained to the students, followed by the application of e-governance in community pharmacy. Who are the regulators for this e-governance and what is the role of pharmacist in e-governance? These topics can be discussed under e-governance. Coming to good regulatory practices in hospital pharmacy. Now, hospital pharmacy is a setup in which you need a drug information services section division. The significance of hospital formulary, which is the reference point for the pharmacist as well as the doctor. Various licenses as applicable in hospitals and their validity and renewals should be explained. So in the previous slide, we looked at the good regulatory practices in community pharmacy. Now we are looking at good regulatory practices in hospital pharmacy. Here we can explain about the drug information services division and the hospital formulary, which is the reference point for any drug or medicine that is to be issued to the dispensed to the patient, and the different licenses and renewals that are applicable in the hospital setup. Finally, the importance of e-governance in hospital pharmacy can also be explained here. Next, we come to good regulatory practices in pharma manufacturing, wholesale business, inspections, import, export of drugs and medical devices. For this purpose, refer Schedule D1 and Schedule D2. For drugs that are meant to be imported, a registration certificate is necessary. In order to understand the procedure and terms and conditions for obtaining registration certificate, go through Schedule D1 and explain to the students. For obtaining license for import, go through Schedule D2 and explain to the students. And finally, licenses related to import of drugs can be again revised with the students. The last topic, that is medical devices. There's an entire chapter devoted to that, and we will discuss medical devices under chapter 21. Coming to chapter 15, this deals with the BCS system of classification, and under this topic, we have to discuss first of all the BCS classification system. The BCS classification system, that is classification of drugs into class 1, class 2, class 3 and class 4 have to be discussed in brief. This is followed by clinical trials where we can refer Schedule Y and discuss phase 1, 2, 3 and 4. And then we have to introduce the concept of new drug development. So new drug development takes place in 5 stages: target identification, lead identification and optimization, medicinal chemistry part of it, preclinical research, that is animal studies, followed by clinical research. So new drug development should be explained in the form of 5 different phases as given here. And you can refer any standard textbook or any review paper to know more about this 5 phases of new drug development. This is followed by explaining what is NDA, what purpose does it serve, ANDA, abbreviated new drug application, what purpose it serves, when it is to be submitted, Schedule Y, that is again clinical studies. Understanding the difference between branded drug and generic drug. This should be explained with the help of examples and with the help of points. Understanding, students should know what is a branded drug, what is a generic drug, what is a trade name, what are intellectual property rights. Very important to understand what is intellectual property, its classification, its benefits. These points should be explained to the students. Further, the topic of patents, which is totally new to the students, is introduced here in chapter 15. Here, what are patents? What are their advantages? What is the basic criteria for patentability? What can be patented, what cannot be patented, and who can file a patent? These are the points that should be elaborated upon. Okay, so patents are a comparatively new topic to the students, but very, very important from the point of view of their understanding and application of this knowledge further in their career. So simple points, that is, what is a patent, what are the advantages, what is patentable, so basic criteria for patentability, what cannot be patented, and who can file a patent is very important for the student to know. So from the student point of view, a very simple write-up about patents explaining in general patents, advantages, criteria is sufficient. The last topic that is given in this chapter is emergency use authorization. Now, this is a terminology we have come across frequently in the last 2 years. And it is very important for the student to understand exactly what is emergency use authorization, because these are the students who are going to deal with various formulations and drugs tomorrow. So they should know what is emergency use authorization, whether they can dispense something that is meant for emergency use authorization. So just explain the whole concept of emergency use authorization to them in brief. Chapter 16, under chapter 16, we are supposed to discuss the basic requirements and functions of a blood bank. So as you move forward, you can discuss with the students about what is a blood bank, what are the functions of a blood bank, what is the fate of donated blood, what happens when once the blood is donated, what are the licensing requirements for a blood bank, and what are the guidelines for running a blood bank. These things can be discussed with them. Students can also have a visit to any blood bank, in a closest blood bank, and understand this in detail. Chapter 17 deals with Clinical Establishment Act and rules. Under this act and rules, again, this is a very short topic meant to be taught in 2 hours. The definition of clinical establishment should be given, followed by the information about National Council for Clinical Establishment. We have a National Council for Clinical Establishment, as well as each state has State Council for Clinical Establishment. So both these can be explained in brief. Constitution of the clinic establishment as well as functions for both National as well as State Council for Clinical Establishment can be given. How to go about registering these clinical establishments or clinics, and what are the offenses that are committed, and what are the penalties in case of these offenses. These are the topics that are included under the Clinical Establishment Act and Rules. Chapter 18 deals with Biomedical Waste Management Rules 2016. So these are relatively new rules that have been framed as late as 2016, but are very, very important. They have to be covered in a period of 2 hours. Here we can discuss, we can download these rules from the net and discuss what is biomedical waste, definition of biomedical waste, an occupier who deals with handling of biomedical waste. So definition of occupier and the duties of the occupier need to be discussed here. And finally, handling and disposal of biomedical waste that is created at the institute level, the hospital level, at the personal level, all these different situations, how to deal with, how to handle and how to dispose of biomedical waste is to be explained to the students. You can download these rules from the net, go through them, summarize them, and explain to the students. Coming to chapter 19, which deals with bioethics. Here we can discuss the need for having some legal system for bioethics. So history, scope of bioethics, what are the principles of bioethics? What is an ethics committee? What are their duties and functions? And the national ethical guidelines that have been framed by the government and are discussed in detail in 12 sections need to be referred to and need to be understood by the students. Chapter 20 is the Consumer Protection Act. Under this act, the definition of consumer is given. So who is a consumer? What are the rights of the consumer? What are the different authorities and councils who are responsible for consumer protection? A consumer disputes redressal commission to whom the consumer can approach in case he is not satisfied with the solution provided to him. What is the liability as far as the product being sold is concerned? What are the offenses that are committed under this act, and what are the penalties levied? All these are important points which can be summarized in brief. So download the Consumer Protection Act and discuss definition of consumer, rights of consumers, the authorities and councils for protection, the Consumer Disputes Redressal Commission, liability of product, offenses and penalties under this chapter. The last chapter deals with medical devices. Medical devices come under the purview of the Pharmacy Act, and these are being slowly included into mainstream pharmacy. So we need to know and understand. Therefore, what you should do is explain to the students about the definition of medical devices, the categorization of medical devices. They are categorized into class A, B, C, and D. These categories have to be explained to them, as well as the legal requirements and licenses for manufacture, sale, and distribution of medical devices. Okay, so this is a summary of the 21 chapters that are expected to be discussed, explained to the students under the subject of pharmacy law and ethics. I have been very lucky to get the opportunity to write a textbook on pharmacy law and ethics, for which purpose I have to thank my publisher, Brilliant Publication, who gave me this opportunity. So whatever I have discussed is based on the notes that I have prepared and put forth in this textbook on pharmacy law and ethics. So thank you, dear audience, for a very patient listening at the fag end of the day and the last session. I very much appreciate and thank Dr. Somani, who I think is there in this discussion right now, for giving me this opportunity.
Thank you, ma'am.
Thank you.
Thank you, ma'am, for sharing such a wonderful information and the presentation which you have presented over here. This is one of the important information all the participants, they must have got it. And one more important thing here I would like to mention that in the first slide only you have mentioned there are new amendments. So from that we have clearly mentioned that yes, from the year 1991 to 2021. So there is what all are the changes with respect to syllabus that has been mentioned, and each and every chapter in detail, what all points we have to discuss with the students, as well as various notes and textbooks which you have referred for this subject. You have very well mentioned in this session. So thank you very much for this session, ma'am.
Yes, it was my pleasure. Thank you.
Ma'am, if there are any questions, I just see this.
If there are no questions, that I take it as my presentation has been so good that everybody has understood all the points discussed. And yes, like I said, for further reference, each one of you should go and download the act and the rules, every act and rules, and go through. Those which are not mentioned, you can go through the community pharmacy practice that is published by IPA, as well as my textbook, where I have laid down all these points more elaborately. Thank you.
Yes, ma'am. Yes. Ma'am, I would like to request all of you, Dr. Rakesh Somani, our principal of D.Y. Patil College of Pharmacy, to deliver vote of thanks. Respected sir.
Take us around 2 minutes.
Dr. Rakesh sir, are you there in the meeting?
Yes, yes, I'm very much there. I was just waiting for your signal.
Yes, sir. Yes, definitely, sir. We have completed the last session, and as I have mentioned, ma'am has delivered very nice session, and the
Yes,
presentation.
I attended that. I could see it. She was talking very nicely.
Yes, sir. So I am requesting Dr. Rakesh Somani, sir, principal of D.Y. Patil College of Pharmacy, to deliver vote of thanks.
Okay, thank you so much, madam. So, good afternoon, rather good evening to one and all present on this platform. It gives me an immense pleasure to extend my thanks to each and everyone involved in this activity, particularly the speakers, speakers from different colleges who have attended today this particular session and who have been, devoting their time for the students as well as faculty members. So let me first of all appreciate all the speakers right from yesterday till today who have passionately spoken about how this education regulation 2020 can be disseminated for the diploma students. Secondly, I congratulate all the participants, that is particularly the faculty members who have attended this program, because without participants, such kind of faculty development programs are not successful. And so I'm told that close to more than 800 participants have registered for such kind of program. So naturally, there is a good kind of success. Third, importantly, I would also congratulate Mr. Aditya Guge, who is our coordinator for this event, for our very own faculty, for organizing such a wonderful program. And also, I congratulate Mrs. Anjali Chakke Madam for her immense contribution in this program. We have formulated a big team of ER 2020, wherein Dr. Manjari Garat, then Dr. Sanjay Toshniwal, Dr. Dias, Dr. Aragade, then Dr. Ittadwar, all these stalwarts in the field of pharmacy, particularly in the diploma education, they are involved. And all of them have been guiding us for this entire success of the program. So let me thank all of these people who have been involved into designing the syllabus as well as disseminating the syllabus. So thank you so much everyone for attending the program, and I look forward that in D.Y. Patil University School of Pharmacy, Navi Mumbai, whenever we organize such kind of program, your active participation is expected, so that for the betterment of pharma profession, we can do more better things. Thank you so much, one and all present on this platform once again. Thank you. You are mute, madam. Anjali madam, you are mute.
Thank you, sir. Dear participant, as I have mentioned, feedback form link in the chat box. So I am requesting each and every participant to fill the feedback form. Yes, all participants, please fill the feedback form. And this feedback form will not be shared in the group. And those who have filled this feedback form, they can leave this meeting. Thank you, all of you.